continue to allow us to have servants that are going to advocate for the students of the public schools of Robeson County. But we thank you most of all for your shield of protection and covering. I ask you to continue to guide every decision maker that we have. We thank you for the new board member that's coming on. We thank you for the old ones that's also here. But most of all, we thank you for family and for family ties that hold and bind us together. And we're going to give this meeting to you for your glory, honor, and praise. It is in Jesus' name that I ask. Amen.
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 Seeing shouldn't be. I'll be in the governor's office tomorrow around the superintendent. Here we go. Two board members sitting around the superintendent. Other members.
She got to announce it.
Good evening.
Good evening.
Evening.
My name is Brooke Clark. I'm a district court judge here in Robeson County. And it's an honor to be here and to administer the oath of office to some of the newly elected and returning board members. Let me first acknowledge the outgoing board members, just to say thank you for your service and dedication to the children of the public schools of Robeson County. Your work is truly appreciated. To the newly elected board members and the returning board members, what an awesome responsibility you have. It's just a privilege to do the work that you do. It's not an easy task getting to this point. So I know that the hard work that you put in, it's obvious that you have a passion, you have a desire to help children, to see our students succeed. And for that, I'm very thankful. I'm a proud product of the public schools of Robeson County. And I don't mind telling people wherever I go. I graduated from Colonel Sweat High School, and I'm proud of that. I also, at home, I have a rising fourth grader and a 3-year-old. So I, like so many other parents and grandparents, I'm very interested in how your future actions will affect my child and the other roughly 23,000 children in our public schools. So I hope that you take this oath seriously and also just remember that the same passion that you had that got you to this point, always keep that in mind because our children need you. I'm a firm believer that the future of our county is dependent upon the success of our public schools. So again, I thank you for your service, and I'll certainly be praying for you.
Thank you.
First, we have Mr. Lawson. If you want to come up with your family.
Yes, ma'am.
There. The Bible, is that right?
Yes.
Okay, and who would you like to hold the Bible for you?
My wife.
All right, thank you, ma'am. If you would please raise left hand on the Bible, raise your right hand, and repeat after me. I state your name.
I, Randy Lawson,
Swear that I will support and maintain the Constitution
support and maintain the Constitution
and laws of the United States
and laws of the United States
and the Constitution and laws
and the Constitution and laws
of North Carolina,
of North Carolina,
not inconsistent therewith,
not inconsistent therewith.
and that I will faithfully discharge
I will faithfully discharge
the duties of my office
the duties of my office
as a board member
as a board member
of the Board of Education
of the Board of Education
of the Public Schools of Robeson County,
of the Public Schools of Robeson County,
according to the best of my skill
according to the best of my skills
and ability.
and ability.
Congratulations, sir. Thank you. Did you all want to get a picture?
Yes.
Oh,
Peter.
All right.
Yeah.
Mr. Lawson, if you would just step here, please.
I will.
Mr. Lowry?
That's your son.
Together this day.
Got my smile.
He took it.
Thank you. How are you?
My sister.
All right, how you doing?
Who is the gentleman?
A big page.
I know you don't.
Left hand on the Bible, raise your right, Mr. Lowry. I state your name.
I, Craig Lowry,
Do swear that I will support and maintain
swear that I will support and maintain
the Constitution and laws
the Constitution and laws
of the United States
of the United States,
and the Constitution and laws
the Constitution and laws
of North Carolina,
of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge
and I will faithfully discharge
the duties of my office
the duties of my office
as a board member
as a board member
of the Board of Education
of the Board of Education
of the Public Schools of Robeson County,
of the Public Schools of Robeson County,
according to the best of my skill
according to the best of my skill
and ability.
and ability.
Congratulations. Moore is next.
Lowry.
Left hand on the Bible, raise your right. I state your name.
I, Henry Brewer,
Do swear that I will support and maintain
do solemnly swear that I will support and maintain
the Constitution and laws
the Constitution and laws
of the United States
of the United States
and the Constitution and laws
and the Constitution and laws
of North Carolina,
of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge
and I will faithfully discharge
the duties of my
the
office
duties of my office
as a board member
as a board member
of the Board of Education
as the Board of Education,
of the Public Schools of Robeson County,
Public Schools of Robeson County,
according to the best of my skill
according to the best of my skill
and ability.
and ability.
Congratulations, Mr. Moore. Mr. Gentry? Yeah, affirm if you like.
Right. He does.
Raise your right hand, please, and repeat after me. I state your name.
I, William Talmadge Gentry,
Affirm that I will support and maintain
affirm that I will support and maintain
the Constitution and laws
the Constitution and laws
of the United
of
States
the United States
and the Constitution and laws
and the Constitution and laws
of North Carolina,
of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge
that I will faithfully discharge
the duties of my
the
office
duties of my office
as a board member
as a board member
of the Board of
of
Education
the Board of
of
Education
the Public Schools of Robeson County,
of the Public Schools of Robeson County,
according to the best of my skill
according to the best of my skill
and
and
ability.
ability.
Congratulations, sir.
Thank you.
What, baby?
Would you all like a picture? Mr. Gentry, would you like a picture? Mr. Leach?
Wrote it for you, John.
Huh?
They wrote it for you, didn't they?
Told at a young age, you gonna swear on the Bible.
Sir, if you would raise your right hand. I state your name.
I, Vontae Leach,
Do affirm that I will support and maintain
will affirm that I support and maintain
the Constitution and laws
the Constitution and laws
of the United States
of the United States
and the Constitution and laws
and the Constitution and
of
laws
North Carolina,
of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge
and I will faithfully discharge
the duties of my office
the duties of my office
as a board member
as a board member
of the Board of Education
of the Board of Education
of the Public Schools of Robeson County,
of the Public Schools of Robeson County,
according to the best of my skill
according to the best of my skills
and ability.
and ability.
Congratulations.
Thank you.
Are you doing good?
Tell them marker.
Take it out. Stick it on here.
Left hand on the Bible, raise your right. I state your name.
I, Terry Locklear,
Do solemnly swear that I will support and maintain
do solemnly swear that I will support and maintain
the Constitution and laws
the Constitution and laws
of the United States
of the United States
and the Constitution and laws
and the Constitution and laws
of North Carolina,
of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge
and that I will faithfully discharge
the duties of my office
the duties of my office
as a board member
as a board member of
of the Board of Education
the Board of Education
of the Public Schools of Robeson County,
of the Public Schools of Robeson County,
according to the best of my skill
according to the best of my skill
and ability.
and ability.
Congratulations.
Where'd it go?
Vince.
Take that over.
Bill. Something else?
All right, good evening. I'm Vanessa Burton, and I'm also a district court judge. I want to congratulate all of the new board members, but I'm excited for all of the board members because you have an opportunity to start anew and fresh. And we have a difficult season trying to figure out how we can help our children. That has always been a monumental task. And I have faith and believe that each of you are dedicated to seeking a way to create unity to educate our children. Education is the best way to improve the status of your life, and I am living proof of that. It can help you get out of poverty. It has done that for me. So I thank you for being willing to take on this challenge. And I too will continue to pray for the public schools of Robertson County and for our county. All right, if you will raise your right hand. I state your name.
I, John Lawrence Simmons,
Affirm that I will support
I affirm that I will support
and maintain
and maintain
the Constitution
the Constitution
and the laws of the United States
and the laws of the United States
and the Constitution
and the Constitution
and laws of North Carolina,
and the laws of North Carolina,
not inconsistent therewith,
not inconsistent therewith,
and that I will faithfully discharge
and I will faithfully discharge
the duties of my office
the duties of my office
as a board member
as a board member
of the Board of Education
of the Board of Education
of the Public Schools
of the Public Schools
of Robertson County,
of Robertson County,
according to the best of my skill and ability.
according to the best of my skills and ability.
All right, congratulations.
I was hoping that would happen. Pick up evening. Use this. Oh, okay. That way.
And at this time, we're gonna allow our returning board members and newly elected board members, just a few minutes to give, introductory remarks and just express anything you'd like to, say to the audience tonight.
I would have to say it's really good to see all of you all. I'm looking forward to working with our new board members. And I would really love to see the judges take pictures with the newly elected board members before they leave.
But they can keep that also.
So,
We've been outside for 25 minutes.
I just want to thank the ones that supported me during my campaign for District 7 School Board. I've served 2 terms as at-large board members. And at-large board members, I can say this, Robinson County is huge. And you're gonna get calls from Parkland and all the way to Roland. So, but in saying that, the ones that supported me during the wind, the rain, the storms that came through during our early voting and on election day, I want to thank you from the bottom of my heart. I love you, I appreciate you, and I will do my best in this District 7 school board seat, knowing that Steve Martin had it before me, and worked hard for the school board. So I got some shoes to fill. Probably won't ever fill them, but I just want to say that he did a wonderful job, and I'm glad to be sitting here tonight, and I thank you.
Just like to say that I'm honored to be here tonight. I had over 30 years of experience as a teacher and administrator in public schools of Robeson County. And I hope to bring that experience with me to this work. I do love children, and I know a great number of you tonight, and I have appreciated the comments and the support that so many of you have already given me already, and of course the voters who spoke at the polls on election day. And I'm just looking forward to getting in harness and working with everyone to do what the best we can for our children in Robeson County.
I want to thank everyone for working tirelessly for this election, and I want everyone to know that I stand not only just for my family, but for everybody's family. It's time that we come together as one, and I think our nation is proving that day and day as time goes by. And I think that collectively we need to respect each person's opinion and decision-making. We need to include everyone, and we need to become more transparent and accountable. And that's my goal. And I look forward to working with this new board, and the interaction I've had so far, I'm very impressed. Thank you.
I'd like to thank everyone that has supported me during my election, during my campaign and stuff. Also, I'm looking forward to working with the board members. I'm looking forward to working with each and every one of you to get our school on a great track. And like I said, I'm just thankful and happy just to be here.
First and foremost, I want to thank God for allowing this to come possible for me to be on the school board. I want to thank my family. I want to thank the people of District 1. I look forward to working with everybody on the board to making our school the #1 school in the. Thank y'all.
I want to thank everyone, especially my family who's back over here. And I'm thankful for the support I got during the election, but I'm more thankful that I had no opposition. That made it a lot better. But the first 4 years and ever since I've been here, it's been my objective to do what I can for the children in every one of the public schools of Robeson County. And that's what I plan to continue to do the next 4 years. And thank you for all your support. And I'm especially looking forward to working with the other 10 board members. Thank you.
Thank you for the voters of District 4 for your faith and support in me. I can promise you that I'm going to do all I can to best represent the district and the entire school system as a whole. I definitely look forward to working with the board members here. As I was reading the policies, it kept reminding, there was some language in there that was constantly reminding the board members that as a single member, you don't have any power. Your power comes from being part of a board. And that's the way I feel that I'm going to, that's the way that I'm going to approach working with each one of you. And I feel like we're all kind of going to be rowing in the same direction. And I'm hopeful that we can get a lot accomplished in the next few years. And I want to also thank my family for being here and supporting me along the way. And I look forward to their continued support because I'm definitely probably going to have some late nights and long days. But again, thank you for allowing me to have this opportunity.
And next, we will select the chairman for the next year. And at this time, we open the floor up for nominations.
Madam Superintendent, I'd like to nominate Mr. Craig Lowry.
I second that nomination. I move that all nominations come to a close.
Yeah.
Second.
So this,
Second.
I did.
Okay, thank you, thank you.
all those in favor of Mr. Craig Lowry serving as board chairman, please raise your hand. And you're gonna go over there where. City manager.
Let me say thank you to the other board members, and I'm looking forward to this and looking forward to the challenges that I know we have, and we know we got a lot. All we have to do is say COVID-19, and that's it. And from there, we've got to go. And that right there is, we could sit here and talk about that for hours and other things, but I'll leave that part at that, and we have a lot to do. At this time, I would like to take nominations for vice chairman.
Chairman, I'd like to recommend Mr. Mike.
Second.
Okay, we have a motion and a second.
That we close on the one said name.
Move that all nominations be closed. All those in agreement of that, please say yes. Yes. This time, all those in favor of Mr. Mike Smith being vice chairman, please raise your hand. Thank you. Fifth, vice chairman.
Let me slide down.
How to say it nicely.
At this time, folks, we were able to get you here and do all this with what's happened so far, the swearing in and the elections. So the meeting is virtual, the remainder, and the board members will be here along with the cabinet. So all the visitors here, we thank you very much for coming, but at this time, we will excuse you. And thank you.
And Mr. Chairman, before the judges leave, as the time passed, we had pictures with us. When if we could get those pictures.
They can. Is it just for the new emergency?
Brenda, who you want?
I'm sorry, that was.
Sir,
New people?
new people.
Yeah.
Those that they swore in, yeah.
Sworn in? Mr. Randy, come on up.
Of course. I'm gonna let Gordon take that. Gordon.
Come over here.
You know what, Gordon, it was right out here. If they. Pick it over here. Anywhere.
Got her over here.
No, that's fine. Okay, yeah.
On the flag.
It's
Ready.
Yes.
Guys,
Have to line them up, Gordon, you don't have to. The board member.
I'm like you when I get younger.
You get, oh, no, I don't know what I'm talking, I'm sorry.
Over here, I'll be right back.
That's fine. Okay. So we need. And Ms. Mr. Terry?
Thank you.
Will some kind of audio, something be turned on where you can hear people? Is this the volume we're gonna get with?
Dr. Peace, you're gonna be next, okay?
All right. Yeah, I love that, man. I love that. Even with a microphone.
Okay, Mr. Jackson. Bye, Mike.
We don't have any mics for each other.
Hold on 1 minute, y'all.
We don't have any mics for each other. All the mics are for live streaming.
Where's the last
One, two, three.
I'm in bad shape.
Thank y'all.
Can y'all, some of you turn this way and then the other ones turn this way? Yeah. Okay, you turn this way. Miss Craig, you turn that way a little bit. Yeah. Huh? Okay. And y'all come closer together for me.
All right, 1, 2, 3. Thank you.
Congratulations.
Thank y'all.
Thank you.
Yeah, we were outside, we were trying to get, about 7 or 8 of us out there.
That's a shame.
Well, it was fine, but it was,
The agenda,
so we want.
I'm gonna put our
Yeah.
under CARES Act.
Yeah, man. Oh,
I mean, the help.
put on doors and.
Just folks.
So they have built.
That's chair.
Okay, at this time, we're at the adoption of the agenda, and I would first like to ask that we add a health update under the information items. And under the information items, we had health update.
First.
Where are you gonna add it, Mr. Gray? Chairman, where are you gonna add it?
Add the health update, it would be the first thing under the information item.
All right.
All right, first thing under information items would be the health update. And then if you go down under the CARES Act update, we will have an RCC agreement. Again, under the CARES Act update, there will be a RCC agreement. At this time, I'd like to ask for a motion for the adoption of the agenda.
So, Mr. Chairman?
Second.
Have a motion and a second. All those in favor, please say yes.
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 All those opposed? Thank you. Motion for approval of the minutes at the last meeting.
Make a motion to approve the minutes.
Second.
Motion and a second. All those in agreement, please say yes.
Yes.
Any opposed? Thank you. Okay, under information items, the first item is our health update, and I'd like to ask Dr. Robin Pence and Mr. Bill Smith to come forward.
He has more staff, but they are here.
And the other staff to please come forward also. Is it at the same time or are they different?
Same time,
Okay.
they're all.
Good evening.
Good evening.
Dr. Wooten asked us to comment on my part is history and lay the land, if you will. But I have Beth Rao, who's the Director of Nursing, Tracy Jones, who's over our epidemiology. So, COVID-19, North Carolina's had 89,484 cases. Of those, Robinson County has 1,708. Deaths, there's 1,502 deaths for the state, and Robinson has 46. Now, Robinson is about 1%, a little bit over 1% of the total state population. So if we mirrored the state, we should have about 894 deaths. So at 1,708, double what you would expect normally. I'm sorry, cases. On the death side, we'd only have 15. But we have 46, so we tripled the deaths. So it has impacted us much more than it has other counties. If you look at the health rankings, which come out every year, we typically sit at top to bottom, whichever way you want to read the word. We're number 100. And we've been the 98, 96, moved back. But it really doesn't matter if we're 90 or 100 or 80. Those are all bad counties. And our problem is we're the only county 80 and above that has a population. Most of them are small counties like Bladen and Scotland. So we have a lot of people. So we have a lot more of the diseases, and it would be a lot harder for us to change the total population. But you look at it, the health outcomes, we're 100. That includes a lot of premature deaths. We do not have the life expectancy other counties have. You look at health factors, we're 100. In that area, you have we have 3 times the percent of children in poverty that the rest of the country has. We have 2.5 times more single parent families. Y'all know that because you're working. And let's move just a little bit. Only 38% of our population gets flu shot. But if you watch TV, the big saving grace is what? Well, when they get a vaccine for COVID-19, we're going to be saved. Yeah, 1/3 will, because by that time, 2/3 of the people are going to treat it like a flu shot and not bother to get it. So that is certainly not going to be it. We're going to have to look at the masking, the distance, sometime. If you look at what conditions COVID-19 is exacerbated in, sickle cell, obesity, kidney issues, type 2 diabetes, heart, think we just described Robeson County. Secretary of Health said 50% of North Carolina has underlying causes for COVID. I would say Robeson County's probably at 2/3, 67%. So we're going to have problems here based upon the fact that we have all these underlying conditions. Now, as far as a lot of the specifics, I'm going to let Beth talk about that.
Apologize, we couldn't hear back there. We just heard help. Just wanted to talk to you a little bit about starting back to school and what the challenge ahead county. So the big things: wash, wait, and wear. I want to commend everybody for having your masks on tonight. That's one of the big things, is making sure that everybody in the school system, when school starts back, they are in the class or in the school system, they have to wear a mask at all times. Y'all know we're dealing with kids, so they're gonna wear them around their ears and around their nose, and they're gonna try to play with everybody else's. So that's gonna be a challenge. Even adults, when you see them, they have them pulled down around their nose, or they're constantly touching their mask. And what are you doing when you're touching the mask? If you've been with somebody that's spraying germs onto your mask, which is what the purpose of wearing a mask is, to keep those germs from entering in and out the nose, but yet you're constantly touching your mask, then you're getting those germs on your hands, and then you're touching everything. And so that's gonna be a challenge. Waiting the distance 6 feet apart. No, children really know how to do that, don't they? So it's gonna be a challenge for the teachers and the school system to make sure that that's happening. And then washing, frequent hand washing, so that's a big thing. A couple of things we talked about on the phone call this morning. We met, talked with Stephanie Locklear, the school health nursing supervisor, and several others today. And one of the questions was, well, what if we have somebody that is sick? You know, the various scenarios, what's going to happen if a teacher's sick? If they're sick, they need to go home. It needs to be made simple for them to go home. We know that teachers will come to school with a runny nose and with sniffles, and I've just got a sinus infection, I really need to be there today. If they are sick, they need to stay home. If students are sick, they need to stay home. They don't need to come back until their symptoms have improved. And so that's going to be an HR challenge. You know, what do we do with these? You know, making sure that if they say they've got a positive result, yes, they really have a positive result, and what that means for their classroom and those that are 6 feet, not within the 6 feet confines. Students that are sick, making sure they go home. It's going to be a monumental challenge to screen everybody's temperature every single morning before they go to school. Do their temperature screening, and it's not enough to do screenings, you need to ask questions. And of course, if you've got some savvy students, they're going to know that if I answer a certain way, I don't want to go to school, then that's going to get me sent home, and you're going to have to deal with that challenge as well. So I don't envy you all the hard decisions that you're going to be making in the next month. But the health department is here to support you. We do want to really, for you all to understand that with this population, it's very important if they are sick. If they've been exposed to somebody, my child, you know, a teacher has been exposed to a positive case, but they don't feel bad, and they go to school. No, they do not need to be at school, even if they're not having symptoms, if they've been exposed to a positive case. But these are questions that will come up day after day after day, and the health department will be there. We gave our numbers today to make sure that, you know, call us with any questions or concerns. We'll be glad to walk through those various situations. Of course, we'll put the disclaimer out there, the guidance changes almost daily. So what we tell you today, you may call in 3 days and it's totally different guidance. That's not the health department changing that guidance. We follow directly from the the CDC and the North Carolina DHHS. So whatever their guidance is at the moment is what we're going to go by. So all may have.
The governor stated, well, in the governor's speech today, they gave the pediatrics expert, board member, spoke and said children of lesser age were lesser apt to catch the COVID-19. Being that they're less susceptible, and they were encouraging students, the best learning technique is face-to-face. Does our county echo the same information?
We do, our numbers have shown that a small percentage of ours have been children under the age of 6. We happen to have the numbers.
We had 150 kids under age 17. So again, when she's talking about the state, our kids are a lot more susceptible. There's more asthma, and I left that off my list, but so they're more susceptible. So if the state's this level, we're going to be this level.
And again, you know, that's the age that it's going to be really hard to keep them 6 feet apart, leaving their masks on, washing hands. It's going to be a logistical challenge, to say the least. Yes, the numbers are lower in that age, but we are having them. And you know, unfortunately, we don't know what it's going to do to the younger population because they've been at home. Let's face it, they've been at home. They haven't been, most people have kept their children in. You know, I talked to a woman today. She said, my child's not even been to the grocery store since April. She's not been anywhere. So they've not been exposed as much as the older populations have. So, you know, it's going to be, that's one thing to look at. You know, how is it going to affect when we put them all in a group and they're all in class together and they're, you know, PE, all the different scenarios. How is that going to affect our population?
And there's been a lot less testing in children also. Our largest pediatric group does not test. A lot of places won't test 18 and under. A lot of places won't test under 2. So there's a large portion of those smaller kids who may have had COVID who just were not able to get a test. We have had a 5-week-old test positive. So just because they're less likely doesn't mean that they're not going to.
We may not have had enough time to gather data about the transmission of the virus asymptomatic. But going forward, that may become more important of who has the virus and is carrying it, but is not symptomatic and passing it on to someone else coming home, for example, and passing it on to parents and siblings and that kind of thing.
That's correct. And let me explain kind of how it works. When a person goes and gets a test and they test positive, all results come to the health department, but particularly the positive results come to the health department. And once we get that positive result, we reach out and contact that person and do a 3-page questionnaire. And so we're asking about their travel history, any contacts, if they've been to a physician's office, you know, or an emergency room, doctor's office, where they work. And then we ask about their contacts. And so once we have completed the interview with the positive case, then we start entering the contacts into a state database, and they are contacted and monitored for 14 days if they participate. So we do collect information on their symptoms, where they've been, any contacts they've had, and we enter all that information into the state database. So they are looking at, you know, what the symptoms were. And if you'll notice at the beginning, the CDC had 5 symptoms. It was cough, shortness of breath, cough, fever,
Sneezing.
Those drops.
Yeah, started out with cough, fever, and shortness of breath. And then they added 2 more, and then they added more. And the reason they're doing that is because as we do these investigations, you'll see now one of the main is new loss of sense of taste and smell. That's because a large majority of the people that we interview, that may be the only symptom they have. but they have that symptom. So as we go along, they add more symptoms to what to look for. So we do the case investigations, and then there is a contact tracing component, and we, are trying to link, okay, this person went to the beach with these friends, and then now they've come back and 3 of them are positive, or you'll hear about the outbreaks in the meat processing. We know about those because we do the case investigations, and this person works here, and they went home, and now their household, but it links back to that person that worked at the meat processing plant, or whatever the gathering may be. We've had some gatherings in churches and meat processing plants. This, of course, you've seen about the assisted living places and whatnot.
This might, I think Mr. Smith hit on this, but I know we've heard about the curve, and I know Robinson is exceptional, but are we steady at anything, or are we climbing up, getting worse, hospitalization, or are we getting better, or are we steady? Where are we in Robinson?
Our numbers are continuing to increase. We're seeing increase in hospitalizations.
I get a little louder.
We are increasing numbers, we're increasing hospitalizations, we're increasing hospitalizations in younger folks. So we are seeing all the trends in the wrong direction here.
Mr. Chairman, Mrs. Smith, thank you and the staff for being here. With you all going across the county, what is the stress level that you all have viewed in the individuals in our county in the testing?
I think that varies. We've had some that were very stressed. I talked to one woman 5 times in one day, and she was just crying because she was having some serious health problems and concerned as she should have been. Then we've got some that are, it's not real, and so I think you all seem about the same.
And Mr. Chairman, follow up with that being said, particularly those that had children. I think I better ask that when we can sit down with you all in a meeting to determine some things.
Would COVID-19 interfere with a child learning virtually? See that being a factor, a major factor?
It can be.
Let me understand the question. Are you saying if they are positive for COVID-19?
Yes.
Well, that's hard to say because we've had some that have no symptoms and no, it wouldn't interfere. We've had some children that, depending on if they're asthmatic or what may be going on, they're sicker than the others. So it just.
It's case by case.
Case by case situation.
Another thing that we're seeing, especially in teenagers, is the extreme busy. Like they're so tired that they can't do anything. And if they are so tired they can't focus, yes, that's going to interfere with their learning, whether it be in person or virtually. And some of these symptoms are lingering on longer than the time period that they need to be in isolation. So they may not be infectious anymore, may not be a danger to anybody else, but they may still feel horrible.
Go ahead, Mr. Vontae.
All right, do you think it's safe to send some of our kids back to school here in Robertson County? I want to hear your opinion.
Go ahead.
Yeah, I mean, somebody could have to ask the question.
Hello, I'm Robin Peace, and I'm the president of the medical staff for Southeastern, and I've been practicing family medicine here in Robertson County now, for those of you who don't know me, for over 20 years. I have devoted my medical career to this county. So even though I'm from Granville County, Robertson County has embraced me, and I am grateful that I've been placed here. I absolutely, unequivocally do not feel that it is safe for kids to go back to school in this climate.
Right.
I have spoken with the medical leadership for Southeastern Health, and they are in agreement with me. We are taking care of the patients that are infected with this virus. I realize that there are a lot of issues regarding whether or not our kids go back to school. I see the parents and the grandparents. I know that parents need to work. I know that kids get their best meals, some of them from the school system. I get all of that, but I'm a healthcare provider and I hate seeing people suffer. And I would hate the notion that a child would go to school, contract the virus, not be sick, bring it home to their parent or their grandparent, and that person gets sick and possibly die. I hate the notion that teachers are already stressed with trying to educate our children, but now they have the fear of getting sick and succumbing to this invisible enemy that is, and the symptoms are so broad. There are some adults that all they have is fatigue. I just saw a patient a couple of weeks ago. She thought she had a sinus infection. She has a history of chronic allergies. Many of you probably do. She had no cough. She had no fever. And 2 days after she saw me, that's when she got contacted by someone that had tested positive. That's when she lost her taste and her smell. She never had a fever. So it is like a thief in the night, you know, and I think that because it has not hit us like other states, like New York and Florida and Texas and California, we have this false sense of security that it is not going to just come on us. But I'm worried. I've been praying, I'm concerned, you know, and so I'm grateful for the opportunity to speak to you today, because I think it's the wrong time. You know, if we had done a better job, we've done a good job. But there are a whole lot of people amongst us that they don't subscribe to the mask. I have people coming to my office that don't want to wear a mask. And even though they're not wearing it, they're wearing it to protect me. But they want the medicine, but they don't want to wear a mask in my office. So, you know, how are we going to get our children to be able to do that? I think it's impossible to be able to think that our children are going to keep a mask on their face, stay 6 feet apart in the schools that we have in this county. You know, I'm concerned. So I appreciate it, and I'll table any questions. Yes, sir.
Dr. Pence and Mr. Smith, I think both, Mr. Smith, you mentioned about the low percentage of kids that y'all dealt with. Our working population is age 21 to 65. They work in our schools. Now, so the majority of the other people that we've dealt with, can you talk about that from that age 21 to 65, who I'm going to say is our working people in schools? What kind of numbers there are you seeing?
The most common group to have coronavirus is 25 to 49. They have by far the most. So they're also the most active. So you would expect that, really. And in some ways they're the most cavalier also. They really don't catch it because they're healthy enough, they're going to survive, they'll move on. And then they move it on to their grandparents or their mother.
And there is a lot of asymptomatic spread that is happening. And it's just like you said, I mean, things are ever changing. They're doing studies, but there are a lot of people amongst us that they have the COVID virus and they don't have any symptoms. And so they're giving it to someone else. That's not just children. Yes, that can be children, but there are adults that are infected with this virus and they're asymptomatic for a period of time. And that has been shown to be their most infectious time, is just prior to them getting the symptoms that would warrant getting tested. A lot of patients that I have seen have no fever the entire time. So checking the fever to me is something that we do so we can say we're doing something. But in my opinion, I don't even think checking a fever is going to slow the spread. And it certainly would not make me feel comfortable as an educator, just because you're checking the temperature of my students and they're afebrile. So, I mean, again, they could just have a runny nose and be infected. And so, you know, it's concerning to me because we are the sickest county, or one of the sickest counties in this state. I think that every county needs to look at their population. The majority of us in this county have at least one comorbidity. that would make us much more likely to have serious problems with this COVID virus. And again, I think that because it hasn't hit us like other states, that we just have this false sense of security that it's not going to come down on us. But I'm concerned about it. I'm concerned as I think about not only the teachers, the cafeteria workers, the custodians, anyone that's in that environment in our school system. And those are people that are older. When I think about it, I have a lot of patients that work within the school system. They're the ones that have a lot of these comorbidities that lead to being really sick and potentially dying. And it's like Mr. Smith said, when you look at the percentage of people that have died in our county compared to the numbers that have tested positive, and you look at other areas like Wake County, it tells the story that we are a sick county. I mean, it is what it is. I mean, I've devoted my medical practice to try to help improve that. That's why I'm here tonight, because again, I don't want us to regret making a decision that would lead to people dying unnecessarily. And I saw something today, someone made the analogy that you're more likely to die in a car accident than you are to die from the COVID virus. But if you drive 80 miles an hour and don't wear a seatbelt, then you are pushing the envelope to die in a car accident. If we don't do the things that we need to do to help protect ourselves from this invisible enemy, then we're more likely to have more people to die in our county.
Dr. Peace, and maybe Mr. Smith or some of the others would want to give their opinion also. What, in your medical opinion, what would be the optimal level of the infection rate that you would deem safe to start school back?
I think that we need to see the trends going down and not up. Okay, right now, I don't know what it's going to be a month from now, 6 weeks from now, 2 months from now, but we're seeing an increase in hospitalization. I was just speaking to one of the staff at the hospital, and our ICU was just about at capacity. We have a floor in our hospital that's devoted to taking care of COVID patients. Our hospital system has not been overwhelmed to date, but opening up the school, and the potential for that being a continued increase in numbers, that's what that's what it's always been about. I mean, eventually, a lot of us are going to get this virus. I acknowledge that. But if too many of us get sick at the same time, then we're not going to be able to take care of you. And there's not going to be a hospital to transfer you to if things got really bad like they have in some of the states. I mean, you don't just shut a state back down like some states are doing without things being really bad. And so I don't want that to happen to us here in Robeson County or in North Carolina. So I think the trend need to be going back down in the other direction. We've seen a steady at one point, but they're starting to rise again. And why is that? Of course we know why. Memorial Day weekend, July 4th weekend, young people, they want to be out. I get it. But unfortunately, that's why things have gotten out of control. It's because they go out, they go to the beach, churches are opening back up. And I think that's a mistake. That's right. It's any congregating. I mean, if all of you didn't have on a mask, I wouldn't be in here tonight, okay? Because I'm trying not to get it. And that's what I'm preaching to everybody. You ought to try not to get it. And I don't want to be the reason that somebody else gets it. I wouldn't want a child to know that they were the reason that their parent got sick and died from COVID, or their grandparents. There are a lot of grandparents in this county that they're raising their grandkids. And so they are terrified of the schools opening back up to answer someone's question. They're very afraid about that.
And you don't want to talk to someone who is feeling that guilt, because we've had that, people who were asymptomatic and ended up infecting an older family member, and that family member died. That's a horrible feeling for that person to have to live with, that they feel like they're the reason that person died. Because again, they weren't having symptoms, they felt fine, they thought it was fine to be around their loved one, and now their loved one's dead.
And Mr. Chairman, that was one of the reasons I asked the earlier question in regards to that, because being a first responder, working, giving out a lot of face masks and everything, you know, Clorox and whatever we can do. My next question is, what more do you think we as board members can do to help with this growing thing? I know we can't make nobody wear a mask, but I know we can continue to advocate for it. But what else do you all view that we need to do as a board, or Mike could do?
You can make people wear masks.
I can't,
The governor has, I mean, I think a lot more businesses and employers need to enforce that. Just putting the sign up on the door at Food Line, you should be made.
Right.
Everybody should be made to wear the mask.
I mean, we as a board.
Right. And even, you know, like Beth was saying, with people not wearing their masks properly, without creating larger spaces, there's really nothing else that we can do. I mean, you're cleaning as much as you can clean. You're monitoring people. And again, about the temperatures, most of the COVID cases do not have fevers. But screening for temperatures, if you've got a fever, regardless of what it's from, you don't need to be at school. So that's my take on the fever. I don't really think it's a good track for COVID, but if you're running a fever, regardless of the reason, you don't need to be at school. But as far as anything else, unless some new science comes out, I think we're doing all that we can do at this point, other than keeping these kids out of the schools and off the buses.
I think if you use social media, your platform as Facebook, the school board Facebook page, and push the washing of the hands, the wearing the face mask, the waiting, the social distancing. If you really keep putting that out there, if people hear it enough and they start seeing more and more people adhere to that, then some will follow suit and will do the same. So it's being an example. You be the example. You're the school board, you carry a lot of, what's the word?
Influence.
In the community. People look up to you all because you are the school board.
I agree.
Wear your masks.
I agree. You set an example.
You know, if you see somebody that's sick, you know what? You know, maybe you should go home and, not be out in the community without, you know, until you feel better, things of that nature.
Very good.
I have a question concerning testing. Do you also have the same concerns if schools were to go back, that Robinson County can handle the amount of testing that may be available, that we may need to have at that point? And would people who are asymptomatic, say if we had a child test positive that had symptoms, but then the whole class had to be tested, most of them don't have symptoms, are they able to get a test, or would we just have to stay in a cycle of quarantine with those?
I don't think that we have the capacity, because in all of the literature, it tells you everybody should, that's a recommendation, but the asymptomatic people should be prioritized. So if it gets to the point that you're having more more symptomatic people, not just in that classroom, but as a county, they're going to be prioritized for testing, and you may not have enough. And as numbers increase across the nation, there are lots of things that go on in the laboratories for those tests. And our hospital is fortunate to be able to do testing in-house. But when they don't have the proper reagents and cassettes to run those tests, it stops. And it may take you 7 or 8 days if you have to send that test out. So when things are running smoothly, yes, you can get your test results in a timely manner. You can test people. But if other areas are increasing higher than we are, those resources may be pulled from our hospital and given to another state or another hospital who's having more of an increase than we are. And there's nothing that we can do about that.
Very concerned about the capacity to test. Absolutely.
And at the beginning, it was taking up to 10 days for people to get test results back. And then they really peaked it up with the capacity. We were getting results back sometimes within 24 hours, and these were in send-out tests. This was before the hospital started testing. But we're back at 5, 6, 7, 8 days to get test results back from these send-outs.
And I think that just speaks to the number of tests that are going to these companies that are putting out the results.
And again, a lot of the easy tests, the drive-throughs, they're not doing children. So your school-age kids, that's a gap there that we're missing with our children not testing. A lot of the primary care clinics do not test children under a certain age. So if school goes back in, that's something that needs to be looked at by our medical community as far as testing. There's a hospital clinic that tests, but they don't test under 2.
The health department tests, but we have, we don't have a large capacity. So, our numbers are smaller than what we need.
I think what else adds to that burden, though, is for every positive case, you've got employers that require 2 negative. Now you've tied up 3 tests. And a lot of those people still have the burden, so they're taking 4 or 5, 6, 7 tests to try to get back in the workforce.
We've had people that have been tested 9 and 10 times to get back to work, to get those 2 negatives.
Excuse the interruption, Ms. Erkin, this guidebook on page 19, that addresses those questions you asked. The guidebook, it's a recommendation is what to do, and I think this is why guidebook here, and enjoy it.
Who absorbs the cost on these tests and how much does it cost to get a test? Is it the insurance companies or is our state or federal government doing that or?
Insurance companies are paying for it. Some places are purchasing out of pocket. There's some that are donated, so it varies. I know.
There's a federal, get reimbursed for doing testing. A lot of minor players, let me say it that way, they don't want to get into that paperwork. So you'll find a lot of them that will do it, but some will just charge.
Like all of the different areas that you've seen on social media where Robinson Healthcare are testing, at different churches, those tests are free to the patients, to the public. So if you need to get a test in Robinson County, even if you don't have insurance, you can get a free COVID test. There's lots of options for a free COVID test in our county today.
For adults.
For adults. For adults.
Not for the children.
There are not as many areas.
Does do children.
And we do up to 2.
And I think.
Under 2.
Mr. Chairman.
Ms. Brenner, before you do this, let me make a comment, because of the way you folks are sitting. There's hands on the sides that you might can't see.
Okay.
So just as a comment, if you have a question, please raise your hand. And I would ask too, that you direct it to the chairman and let me recognize you so we get the question asked in order of the people that raised their hand, and then you direct the question to whoever's up there. Thank you. Ms. Brenda?
I'm not for students going back to school. I say that, and I posted it on Facebook, and Dr. Peace, I keep advocating for the mask. Mr. Smith, also. But this is my opinion, board members only, okay? I believe that if we were to go back to school in August or September, and the numbers are still high, I think we should have to absorb that cost. That's my opinion, okay? Because.
Oh, Ms. Brenda, talk louder there. Couldn't hear that last thing.
I said my opinion only. Let me try to get me some more voice. My opinion only. I believe if we should go back to school in August or in September, knowing these numbers are high, I believe we as a board should have to absorb that cost. If somebody were to test positive from going to our schools, staff or student. Because I believe not only would it come from, we don't know where it comes from, but they take it back home. And there could be sick parents, we would need to keep up with the tracking, and there's no way we could do that. My opinion only.
Terry?
What are your thoughts on our capacity to possibly do the pooling of samples and testing that way?
What's the question?
That's something that's done at the laboratory level, as far as pooling of samples.
Do you think that's a possibility for our schools?
Just broadly test, is that what you're saying?
Taking a lot of samples and putting them in the same repository and just testing the repository versus giving out individual tests. Okay.
I mean, I think it's possible. I don't.
But it would be a lapse.
Mr. Smith?
I'd like to stand up so that way I can be heard. I've been listening ever since I've been here. And, guys, we're getting it straight from the people we need to hear it from. Okay? We're getting it. Okay? You don't need to wait for a governor to wait 2 weeks and everything depends on the governor, everything waits on everything. I mean, there's no good in trying to, okay, well, what about August 10th? What about, listen, it's cut and dry. What we need to do as a board is high school is okay. Help me out if I'm correct here. I mean, I think this is a social session where we can all talk about it. You guys can help us with this right here. First of all, they can do Zoom, virtual. High schools can do that, correct? So high schools are okay. Is that right, Dr. Wooten? Would that be okay to say? I mean, we just need to get real about it. So our concern is K through 8. And what we need to do is, I'm telling you, this is going to be a year right now that, listen, parents, custodians, anybody, everybody is going to have to be aggressive. Don't want to hear, well, you know, my child's this. I mean, listen, even though this is going on and we get it, health is more important than education right now. Okay? But we still have to find a way to educate these kids here, K through 8. There's going to have to be a lot more sacrifices for parents, for teachers, for custodians, for board members, for anybody and everybody. This is unusual. Everybody's going to have to step up to the plate. Right now, you've got K through 8 that you pretty much can't do virtual with K through 8. Listen, we live in Robeson County. I'm not beating up Robeson County. I've been in Robeson County all my life. You got some parents that can't help their kids at a 3rd grade level. I'm not saying that in a bad way, but I'm just saying this is real. And K through 8, we as board members and, you know, just everybody in general, Dr. Wooten, the whole staff, everybody, we got to come up with a way to say, okay, this is what it is. But K through 8, we've got to find a way to help educate these kids in a way. And I could go on and on, but we can talk about testing. We can talk about it for 2 more hours. It's plain and simple. It's here. It's real. There's no good in starting back to school.
Right.
You just heard it. What we need to do is find out what we can do to be more aggressive, to do what we need to do for these kids K through 8. How does that sound?
I agree 100%. And I'm willing to step up and help.
Right.
You know,
So-
as someone, I mean, I'll write a check to help, to support kids, you know, K through 8, like you said. And I believe that there are other people in this county, or at least that's my hope and prayer, that there are other people that would be willing to step up.
And I
You know,
think,
if they could, you know, just to support our community.
yeah, and I think that's where we have to have help from. Okay, so what do we do for K through 8? And I'm not beating up high school, but I think we're okay on high school. But I think what we need to do is we got to have this right here to have help. Okay, where do we start, or what do we do as far as helping these kids K through 8? You got places in our county don't even have Wi-Fi.
Right.
You got kids that don't even have computers. So, I mean, so this is what I'm talking about, right? Listen, it's just like I told a young lady today, what Plan B might work in Cumberland County is not going to work in Robeson County. What might work in Scotland County is not going to work in Columbus County or Blake, and all of us right here together. So this is where we've got to be aggressive. And I'm telling you guys, it is so, I mean, it's just a touchy situation simply because there's so much tension. And let me tell you why the tension is. The tension is because they're tired of being bottled up. They got to get out and release. And they're, you know, people haven't been able to do this right here. So we've got to come up with a game plan to be ready to try to help these kids. Do I have the answer? No, I don't. But we've got to be able to have some kind of way to help start educating these kids in a safe fashion. It doesn't seem to be in school right now. So what do we need to do to educate right now? How does that sound, Doc? Okay, thank you.
Thank you. Folks, does anybody else have another pressing question on this matter? Because we probably could stay on it for the rest of the meeting. I do want to thank Mr. Smith. Ladies, I don't know your names. Would you like to tell us your names?
I'm Beth Rao, Director of Nursing at the Health Department.
I'm Tracy Jones. I'm the epidemiology nursing supervisor at the
Okay. And Dr. Pence, but Peace, I'm sorry, Peace. I remember that from years ago. But I'd like to just thank y'all for coming out tonight. You gave us a wealth of information. And I would like to thank your passion too for what you did, because we could definitely tell, you're passionate about what you're talking about. And I always love to see that. But I'm sure in the next few weeks, days, months, we're going to call on you again with what we've got to put together. And Mr. Smith, with what you were saying there, and I was going to add to this, in your packet, there's work sessions here tomorrow, Wednesday tomorrow, Thursday, and we're going to talk about it on Friday. This working on what we're going to do. And as board members, if you're able to come out, I think the times are like 10 to 4 each day. If you're able to come out and you don't have to stay the whole time, but if you can come out at any time and sit in on what's going on, and then we're going to follow up with a meeting. But ladies and Mr. Smith, what y'all have given us is very valuable, and we definitely appreciate you coming out and doing this for us tonight.
And we have committed to coming over.
Mr. Chairman,
Yes.
I would wonder if it would be nice if we could add these experts to, or if they would be willing to come back on a bi-monthly or monthly basis and give us a report.
Well, we can do it as needed, because basically them coming out tonight, the call was made yesterday. So they're willing to come almost on the spur of the moment. We'll try to do it, a little more advanced than that, but we'll try to get and do that. Ms. Melissa?
And Mr. Chairman?
We did ask if they would help participate in our work sessions.
Okay, that's
Great.
I'll get ready to say.
They're going to submit a schedule to us, and they have agreed to come and work with us some during our work sessions, Wednesday, Thursday, and Friday.
Mr. Chairman, that was going to be my recommendation, but thank you.
Anyone else? Okay, thank you.
Thank you.
Okay, next item is staffing updates with Ms. Melissa Thompson. And while she's doing that, folks, I'm going to pass out some information, and I'll talk about it later on.
I will try to speak loudly. If you can't hear me, just kind of to me. So there are 3 bullets under staffing, and that's the return to work plan and work schedules. We were asked to mention retirees, certified and non-certified, also beginning teacher support program. So at this time, I will address the return to work plan that we have enforced in Robinson County. And for the most part, I met virtually with directors, supervisors, principals, those people that head departments and supervise other individuals. And what we said, what I said to them was, according to CDC, our governor, and other guidelines that we have been encouraged to work flex schedules and where at all possible, remotely. And so this is what we have enforced. And we realize that there are employees who cannot work remotely. For example, the painter, the plumber, the bus driver, child nutrition. These people cannot carry out their duties and responsibilities from their home by simply getting online and communicating in that manner. So therefore, those people have gone to work. But even with them working,
their supervisors have developed flex scheduling. They may be working 2 to 3 days out of the week and remote working the other 2 or 3 days. They may be working several hours of the day and take turns with different shifts throughout the day. But for one person to give one order of practice for scheduling is really impossible now because, like I said, different departments require different practices. Human resources, my department, for example, I have people that go in every day. No one person goes in every day, but like someone is there Monday, Wednesday, Friday, someone is there Tuesday, Thursdays. If there's an emergency and I work Monday, Wednesday, and Friday, I may go in on Tuesday because there is that emergency. If I see where I can carry out my duties at home, and my networking, then that's exactly what I do. And that's what my department is doing. But there are days and situations where we actually have to go into the office because there are things we cannot do from home. So that is, in a nutshell, the way we have handled our return to work for the summer. Normally, we work a 10-hour, 4-day week. That has been left up to the supervisors, the principals. What will work at your school with your employees? What will work in your department with your employees? Because we all have different situations, whether it's childcare, taking care of an individual at home. I have no internet access at home. I've got to come into the office. I can't paint the classrooms at W.H. Knuckles from my house. I've got to go. But where people have gone in and where people are going in, we stress the WWW. 6 feet apart, wear your mask, wash your hands. We had a department last week that we shut down completely because we had a positive case and we got scared. Well, I spoke with the health department today to make sure we were doing the right thing before we brought everybody back. And so, as they told you, those people who come in contact with the positive case, those are the people that have to quarantine the 14 days. But anybody that came in touch with these people that just came in contact do not. And it's like they told me today, every case is different. So just because they told me how to approach this case does not mean that if something happens the end of this week, that I approach it the exact same way. Guidelines may change tomorrow, guidelines may change Friday. So they have opened the door and welcomed a partnership with Robeson County so that when we do have cases, when we do have issues, please call us and we will direct you with what our suggestions or recommendations are. Are there any questions on the topic of our work plan or work schedules?
Dr. Emmanuel,
He was first.
he first, I missed it. Ms. Tanner?
Where does maintenance fit in on this? I'm hearing conflicting information about, part going in. Some's been asked to come in, they won't come in. There's a lot of maintenance concerns that could be taken care of, and social distancing would not be an issue. And I've even been out to schools that I saw principals and vice principals removing trees off of broken fences, and our maintenance people's at home. And I've seen contractors on roofs, and our maintenance people's at home.
So when you say maintenance, that's very broad. So within maintenance, they each have their own responsibilities and duties. So to see an AP or a principal cutting grass at their school may not be maintenance that we have at the warehouse, so to speak. It is not out of the ordinary to see principals and assistant principals doing that kind of work because honestly, we do not have the staff that we need to carry out those duties at the school level. In this past year, we talked about our overages. And that is an area where we had the exact number of custodians employed that the state allows us as far as the formula. But it's not near enough to carry out the duties that we need to take place at the school level. Now, I also investigated a situation because I had heard too that there were people who had been asked to come to work and they refused. Ms. Floyd and I worked on this together, and in talking to supervisors and directors at the maintenance level, they had no concerns with anyone that they had asked to come back and refused. And that was one thing that I had in my virtual meeting with them. If anyone refuses, please contact me as the HR person and let me work with you. Because I totally believe that if you work hard enough and form relationships with these people, they will help us. These custodians and maintenance people, we have good people in Robeson County, and I know they're willing to help us get these schools back to where we need to be so that we can start when we decide to start. So I ask, please let me know. Anyone that refuses to come to work, I will work with you and that employee. Not one individual has emailed, text, or called me and said, employee John Doe will not come to work. He refuses. Not one. I know there's been talk in the community, but no one, as far as a director, supervisor, no one has complained to me that they had someone that refused to come to work, and I have investigated that along with Ms. Floyd because maintenance falls under her. So she and I have worked collaboratively together on that.
And maintenance employees assist in sterilizing classrooms, desk, or whatever needs to be done within schools.
And that's one thing that we have to talk about with our return to work plan. And when we're talking about different areas that have not been coming in, that's one of those things where you don't know if there are underlying illnesses, if they're caring for someone who's sick, if there are childcare issues, and we have been trying to work for it. So even though someone may be home, we don't know all, or everyone doesn't know all the reasons why they may have to stay at home. And so we were working on the return to work plan earlier, and additional duties in terms of cleaning and disinfecting at this point will not just be custodians, it's gonna be all employees. They're gonna have to take that on, but when we bring everyone back at a certain time, that has to be in our induction program, when we do the safety training, OSHA, and we spell out step by step what they're gonna be responsible for and what the additional duties are. So they're no longer defined to just one group. And we're gonna have to do some reorganization when we do have employees come back, so.
Dr. Emanuel.
Mr. Chair, I have a question, about pay. How long are we gonna pay? I'm saying, example, and we do have cases like this. I don't wanna come back to work. I'm just scared of this COVID. When is it, okay, when do they start using their sick leave time? When is it we're gonna start paying people? I think that needs to be clarified. At what point will they be without pay? I mean, all areas.
And we are at that point. As you know, the emergency leave that was in effect this summer ended on June 15th. The only leave available at this point is Families First, which is federal leave, and that expires December 31st. And there's many steps to it, but overall, it gives one person 80 hours or the equivalent of 2 weeks if they have been in contact with a positive person, or if they're experiencing symptoms. After those 2 weeks, they either apply for family medical leave, as we know, or use their personal days or sick leave. But as you know, even with family medical leave, you still use your sick leave days. So with that being said, I do not know, no one has reported to me of any one employee saying, I'm not coming back to work, I do not feel comfortable. I've not had that. No supervisor or director has reported to me that any one person is refusing to come to work. But we do have to start enforcing the 80 hours, but right now, we are working remotely where we can, and we are using flex schedules where we can.
Dr. Wooten?
And I think it's because, we've been waiting truly, for the state level to get some more direction in terms of the types of leave. And we asked those questions this morning. So if someone has to self-quarantine, the guys that we sent home yesterday, are they gonna take their leave? What are we responsible for? Are we exposing them to certain liabilities, even though there may be a safer option? So those are all things that we've been considering, day by day. And we do have some positions, you know, truly, that they may not have anything to do right now, but it's when we come back together this week and talk about how can we use those employees in different ways so that we can provide support, because we're gonna need enhanced support, and we can make some shifts, but that's something that we're gonna have to talk about this week too.
Gentry?
Well, my question follows up what Dr. Wooten just said, and it was, my question was, how have the job descriptions and work plans changed now that students and teachers are not at schools for regular custodial staff? You know, there's a big difference in coming to work and sitting around versus coming to work and having a plan and ABC to do. So you touched on that just now.
Got a lot of work to do.
Okay. Let me add this and ask this question. We went home in March, and we worked until the end of the year. And if I'm not mistaken, all our teachers, TAs, bus drivers, maintenance, everybody got paid. Okay, then we get to the end of school and we stop. Now I know COVID-19's here, but we stop and we go into summer employment or summer work. And everybody has a regular work schedule. Minus COVID-19, we got a regular work schedule. Maintenance got one, central office has got one, everybody's got one. Now, my question is, I have 8 school systems here that they never stop working. Everybody's going to work basically every day, and that has occurred since March. They might have stopped a week or 2 weeks, and the people went back to work. Now, I'm not discussing March to May, but summer employment, and Ms. Melissa, you know, I heard you saying, well, this group's coming in here, this is coming in here. My question is, why isn't maintenance working every day? Why isn't central office staff working every day? IT working every day? Everybody that normally works in the summer, why aren't they working now? And I understand if you got sickness and got to do things like that, but normally they work in the summer. So if maintenance is okay, they can social distance at the school, and there's no telling what could have been done this summer. On buses, bus garage the same way. I think at the central office, there can be social distancing. And these folks coming back and our students coming back is 2 different things. Right. And I think this part about these folks coming back, we need to address this regardless of what we do with students and get these folks back, and then they're working and they're getting paid. And like you say, a painter can't telework at home.
Right.
So they go to work. I hate to say it like that and it sounds ugly, but now just my personal feeling is we need to get these folks to work to doing what they would normally be doing in the summer anyway.
Those who are remotely working are doing what they would normally do in the office.
Okay.
They, Mr. Teal, with his expertise in technology IT, have connected people from their home to the HRMS system. They are able to connect to the systems, like my HR folks, that they would be working with in the office. But then we are also involved in screening new employees, which they can't do from their home. So they come in and they meet with new employees to do the screenings and the paperwork. But our folks are working.
Yeah, I'm not saying.
But they're carrying out the same duties that they would at the office, except they're behind the computer at their home. But where I have internet connection, Dr. Locklear may not, and he has said, I prefer to go into work. I cannot connect. It's taking me all day to get what I can normally do at work in 15 minutes because he doesn't have the connection. And so what I have explained, is it unfortunate? Is it unfair? It's the modern world. We are going to a society where technology is a priority, and that's what people are enforcing. And so, you know, whatever the board decides, if they say that everyone goes back, then that's no problem. Everybody will come back. But what we have been doing is trying to be as cautious as we can, following CDC, lighting our pathway forward, and all the other guidebooks. And it says, work remotely where possible. Use flexible scheduling where possible. So that's what we have enforced in our district. But again, those people who can't paint from their home, the plumber can't do his or her job from home. We have secretaries that are going in to do payroll. They can't do it from their home. But most of them are not working 8 to 4 every day. All of them are working either 2 or 3 days out of the week or so many hours out of the week. Finance as well. I know people say, well, finance never went home. Ms. Erica has said herself, yes, I had to enforce some flexible scheduling within finance. They didn't work all day, everybody. There was flexible scheduling and there was remote work where possible. But I, as your employee, will be here when you tell me I got to be here, although I can work somewhat from home.
Dr. Manning.
We cannot run a school system with technology at home. We have to have a presence at the central office. We have to have a presence. We do. I'm saying it's not like a business, like a factory. We are in public service to children and parents. We have to have a presence here at the central office. And that's just it. I mean, sure, Everett could hook everybody up, but he can't hook all the kids up. He can't hook the parents up. We can't operate through technology or school system totally. We can't do that. And I think, this is my opinion, I think that we must have a presence here at the central office.
So, and like I said, that's up to the board. If you need everybody here all day, every day, that's something that you all can say. I'm just letting you know what we've been doing and what we can do from home. Once we do open the doors, the next question is going to be, are visitors allowed? How many visitors? How do you control that? Are we equipped with the PPE that we need for the safety of our employees? No, we're not.
Mr. Craig?
Yes, sir. Mike.
I can only speak for myself. I appreciate that, and I hope nobody feels inadequate about being here. I understand there's a little bit of pushback, but we need to meet and we need to look at each other's face and each other's body movement and everything else. But my position is, people need to be working. They need to be working every day, just like we are right now. They can social distance. Somebody comes to the door, if you want to check their temperature, and they don't check out, send them back. We don't have to have a lot of visitors, but people are looking at this school system as being employed. As Craig said, he called 7 or 8 school systems. Everybody is working. I can understand remote a little bit, but I can't understand it every day. People need to be on the job site. And I don't want nobody to get sick. I don't want nobody to die, but I want everybody to be working. That's me.
Ms. Tanner, I seen yours, and then Ms. Brenda.
I think you mentioned it, we're not prepared at this moment for like taking care of the specific needs to desanitize or hand creams or whatever we need. But when we look at what's going on within the state, there's other counties far ahead of us. They've already, this is minor stuff to them. It's already decided on, and they're moving forward. And I think the fear is Robeson County's at the bottom of the list, and we're not doing anything about it. And we're not showing any effort to move forward. So we've got to start sometime, somewhere. And, you know, it's like I've heard several mention, we got to have the presence. We've got to start sometime, and we've got to learn to deal with issues as they come. If we're gonna form committees to make decisions on what we're gonna do and workshop, this is something we probably 30 days ago should have been working on.
And I guess that the public doesn't realize the work that has been done behind the scenes. And it really, I know with the cabinet, the superintendent, all those people who are at home working, to hear you say, we're not working, or you want people to go to work, it's time for people to start working, that hurts. Because we've put in more hours than we would at that office. We have worked harder for you all and the children and the communities within this district. And no one knows the blood, sweat, and tears that we have experienced within our homes. Yes, we can be here, and I'll gladly be here tomorrow morning and every day afterwards, because I need my job. But it really hurts, and I can speak for the cabinet, the superintendent, and the other people that are at home. They have not been sitting on their behinds and doing nothing. Now, are there people doing that? Some of them are working their behinds off, trying to make a plan to get these people back to work and the children back in school. I have had teachers begging, can I please, if I've got to teach remotely, can I please just do it from my classroom? But on the other side of that, I've got people saying, I've got childcare, I've got a spouse, I've got the underlying conditions and all these other things. I've got to stay home. I cannot go to the classroom. People in the classroom, or you put HR in that one little room and you got 4 people. Now, when I test positive, the other 3 people got to go home. And anybody they came in contact with, or anybody else I came in contact with. So we shut a whole department down this past week. Are we prepared to send classrooms home? To send, can we afford substitutes when we bring these teachers back? Our central office, suppose we bring all the 12-month people in. How many of them are going to be out before August 10th and we come back?
If I gave the impression that nobody's,
Dr. Manuel had her.
I wanted to follow up on the comment.
Go ahead.
Since we're on this, if I gave the impression that nobody's working from home, that's not what I meant.
I'm sorry, it wasn't you.
What I'm saying is the end result is what's in place. What have we got that's tangible that we can go forward with?
And that's what we plan to share with you all these next 3 days. But no, sir, it was not to you, but it has been stated that we go to work.
And Ms. Melissa, let me just say this, that people that can telework, I'm gonna take, y'all been working, whoever. The issue that's coming to us, and I know you said nobody's called you. I've had people call me that so-and-so won't come to work. One of the cases was when they were moving in this building. They would call maintenance workers to come help. They said no. And it was, I'm not gonna say, I understand they didn't call you. That's the case, they're calling me. I'm coming to work, why aren't they coming to work? And I think that the issue, the main thing we're talking about here, it's not as much the telework. Now, I got my thoughts on that. I'm not gonna say Miss Erica or Miss Jennifer is not working at home. But these folks that do, if it's physical labor at a bus garage or maintenance, situations like that, we need to do what we have to do to get those folks to work. Because, they hadn't been. Now, there's other ones too, but especially situations like that. And do I want somebody to go here and get sick? Absolutely not. But at the same time, when we look and other people are doing it, okay, what did they do to have them at work? And that's what I think we need to look at. And that's where some of us as board members are getting beat up. And I will tell you, there was issues Friday, passing out checks. Now, y'all probably didn't get a call. But now I did about issues of passing out checks. I'm not checks. The manuals or the packets to the board members. There was issues with that you probably didn't get a call about as far as people not coming to work. So that's the reason we're asking these questions, and we got this return to work and talking about when are they coming back. That's where some of that is coming from.
Right.
So we're gonna have to figure out what and when. Mr. Randy and then Dr. Wood.
Skip me again.
I skipped you. I apologize. You got to stand up there a little bit, Miss Brenda.
Too cold to stand right now.
I'll get you after Mr. Randy then, and then we'll get.
And my thing is, Mr. Craig, and everybody in Robertson County knows where I work at. And it's mandatory now that you have a mask on when you come in, and still I see employees with the public schools of Robinson County walking the aisles at Walmart and Lowe's. And, you know, they're supposedly at home working. My thing is that if, I'm saying as far as maintenance and doing hammer and window and nail, things of that sort, physical stuff, now would be the prime opportunity for two men to go to a school and work and get some of this stuff done. Because there's a lot of things wrong at these schools that normally are taken care of in the summertime that haven't been. So at some point in time, we're gonna have to, you know, are we gonna postpone school to get caught up from the summer work? That's what I'm saying. So, and my thing is that, I've had some of the same phone calls that y'all were talking about. I've had people to come and approach me with it. And I'm not talking about one, I'm talking about 20s and 30s of them, about monies that may have been sent, that was COVID money, and they're getting nothing extra, but other counties have paid out extra, you know, already got their extra. So, you know, I want to be in some of these meetings, but I also work to 3 o'clock every day. So if I can make it over here during lunch or after work, I will be here.
Okay. Ms. Brenda, Dr. Wooten, and Mr. Terry.
Mr. Chairman, another concern is our staff, some of our staff we was hearing they could not come to work because they was afraid and fearful, but they working in other places for other people. No mask. I've seen that. I've seen numerous of them without a mask and working in particular. And I felt like after getting so many phone calls about it, I went and checked it out. But I do believe that we should have already started cleaning our schools because that's been the greatest concern that I've heard from staff, is the schools have not been cleansed yet.
Okay. Mr. Terry?
Yeah, my question was going to be, and I think it's been answered in the last couple of statements. It sounds like maintenance is being mentioned a lot. Are we at a point now, as far as countywide maintenance, are we behind where we would normally be, or are we in line where we would normally be, or?
I have not had anyone to say to me their employee's not coming to work and the job is not getting done. The only place I know that we are short is in the area of custodians at the school level, and that's because they are only employed for the most part 11 months. There is normally one person right now at the school doing the job of what 3 to maybe 4 do during the school year. One person. We started last year and we were not allowed to pay summer help. We could not extend employment last summer. We're not extending employment this summer. So where there were 3 and 4 people at the school level, there's one person, be it man or woman, and they're expected to wax the floors, clean the school, yada, yada. We don't have the extra money to extend employment. But yes, they're at work. If they're not, they've not called me to say, such and such is not working, he refuses or she refuses. No one has told me that, and I cannot approach that if I don't know names to approach. So, I mean, they've not brought it to HR.
Mr. Chairman, if I may. So, Ms. Melissa, you're saying that the reason the staff, the custodians and everything, and maintenance, have not started cleansing the school because there was no money?
No, ma'am. There is no school where cleansing should not have started taking place. But you've got one person the month of July that's expected to do everything. But no, they were supposed to be flex working since March. No custodian or maintenance person was supposed to be sitting at home unless their supervisor told them to sit at home.
So not speaking of the care package, there was no money, period, where we could have bought staff back to be already cleansing?
The schools have started their summer cleaning. They started their summer cleaning way back in May and April and May.
See, that's the call I've been getting from staff, that it has not been cleansed.
Right, and we need to
Now,
know.
if they want extra COVID-19 cleaning, that's a whole different conversation.
No, they said period, so I said.
Right. So I
We need to
mean,
know specifics, and we can go check that out. If it's a specific school that has.
I've heard it from all the schools.
That's not true.
I'm just saying what I was told, okay?
and I have some schools that are paying extended employment from PTA, donation money to their schools. I've got about 4 schools who have extended employment, who have reached out and said, Ms. Thompson, we have the money in our PTA budget, or we have received donations. Can Mr. or Mrs. such and such, who's 11 months, come in and work 2 weeks? We will pay them. Yes. And then I send it to Miss Erica and say, you know, if there's any reason why this can't take place, please let me know. So we are working, the principals are working. If there are principals who have reached out to you and said nobody's working at their school, they need to reach out to HR. They need to let me know. My one custodian's not coming because he or she doesn't feel comfortable. But most of the principals, and we've told them, please work with your staff. I know of another school where an 11-month employee has chosen to work the month of July to help get that school ready. And he is going to take a different month off. He's going to take like January off. I have spoken with the principals and the other employees. I said, I know we have good people. And if you work with our people will work with you. And if you can't figure it out, call me and I'll help you figure it out. But they've not called me to help them figure it out.
Like transportation is so far along on that. I mean, they're caught up. They just have like 5 buses apiece and they're finished for all their summer work. So like, work.
Dr. Guzman said they're way ahead of schedule in transportation.
Anything else? Mr. Gentry?
Is it out of the guidelines to use the money or some of the monies that have been appropriated through the CARES Act to pay the summer custodial staff? Is that out of line?
Ms. Erica, do you respond to that?
Okay.
Well, the CARES Act, you have to have data to support everything that you do in that plan. And that money, the carryover has not been released yet, so we wouldn't have access to those funds in order to do that during this month. That's something that I'm assuming Dr. Wooten and Ms. Freeman, it's on the budget later. It's on the agenda later on in the meeting that they're going to talk about. But you'd have to have data to support that need. And again, just the timing of when those funds are going to be released wouldn't support payment in July because of them being federal. That cash won't be released yet.
Dr. Emmanuel?
I'm glad, Miss Melissa, you agreed to, say that you're willing to do whatever to work, but we do need a presence, and I'm sorry if you're upset, but we need a presence at the central office.
And I'm not upset, but I will tell you, in talking to Ruben Reyes in Cumberland County, they are still not back to work. So I have talked to Bladen, I've spoken with Moore. I have also done some research.
But excuse me, this is Robinson, and I think we need to come to work for my opinion, and if there's a vote for my vote.
Yes, ma'am, absolutely. And no, I'm not upset. I'm at the mercy of the board to do the job I was put here to do, but we are trying to take care of safety first for our employees, because we don't want departments going home all at the same time.
Dr. Williams?
And if we could, we have compiled some information. And so if you can just give us tonight, and I'll put together a list of the 12-month employees, the 10, 11-month employees, and talk about which ones could possibly still telework. If there are underlying conditions, we can look at accommodations, modifications, and if they need to work remotely, but we have it together and I can send it tonight as soon as I get home. But this is the kind of information, and we can take a look at it and come up with a hard date in terms of when they need to show back up in the buildings. But I have it, we can categorize it anyway so you can get a better understanding of it. And we can begin with that first thing in the morning if you'd like to. But we have the framework that's laid out, some things that have to take place before PSRC can bring everyone back safely. And we can really provide that to you and let you look at that.
Does that mean the central office? You're talking about the central office?
Yes, ma'am. So I have this is just tentative.
Names,
Cabinet, central office maintenance, technology, transportation, like the courier, bookkeepers, secretaries. So we've got it, I've got different groups of employees under different months, like 12.
So they could never come back if the COVID goes on. Is that what you're saying? If they continue on, if you continue on with that?
I think there are different things. We've got a checklist. Can they telework? Are they in a high-risk category? Are they concerns with childcare?
Because I got some questions. We might need to save specifics for personnel, because I have some questions that would bring up people, so, I mean, go ahead.
Go ahead, Nick, finish that.
But like, I can send this to you, but just generally speaking, and then if they can't, if there are issues with the duties, reassignment, telework, high-risk childcare, and we can't provide accommodations, modifications, and assistance, then that's when HR needs to begin talking about different types of leave that need to be taken by employees. So there's a step-by-step and there's a checklist for different groups of employees. And that's just what we need to communicate as a board, as a district, and then give a date on when we're gonna come back, because we need to call everyone back, and those who cannot come back, that's when we have to take it to another step and decide what we're going to do, and can we use those individuals in other areas in the public schools of Robeson County. So while we won't need certain jobs, positions, we will need more of certain others. And that's just something that we need to talk about. If we decide to go more stringent to Plan C versus Plan B, they're gonna require different staffing options and requirements in terms of human resources. But that's one, now that we have some direction from the state, and we can decide together based on just our local needs in Robeson County, then we can talk about what we want to see happen in the school system.
So when do you think, Dr. Wood, Mr. Chairman, if I may, when do you think cleansing will start taking place in our school system?
Say it louder.
When do you think cleansing will start taking place in our school system?
Cleansing would take place in our school system.
See, there are two different issues going on. We have our everyday jobs, and then we have our COVID-19 jobs. So we have our summer cleaning, the routine summer maintenance. Then we also have other things that will come into play once we bring individuals back. So you're gonna have regular like maintenance, and then you're gonna have disinfecting, sanitizing, and others when we have cases or outbreaks in our schools. So do I think we're behind right now in terms of summer cleaning if we were to open on August 17th? No, because last summer is when we could not do extended employment. We didn't have those guys working in July, and we still got it done because we had feeder schools working with high schools. We had a schedule where we were able to get the schools up and running. So.
But normally, Mr. Chairman, Dr. Wood, normally we have the community that will come and help us to get everything before school started. We cannot do that this time, and that's why I would want to know if and when they propose to clean the school.
They've already started.
They've already started?
Yes. They already started the regular routine summer cleaning.
Okay.
Mr. Booker, with this conversation, do you think, is there any specialized training for cleaning for COVID-19? And if so, do we need to consider sending some of our maintenance people for that training?
We have OSHA, and we have Tim Bass and several other employees who are taking courses so they can understand the types of routine maintenance specific to COVID-19. But this document right here, Lighting Our Way, this is what the state provided. And so we shared in the Google Drive with you one that's tailored to the public schools of Robeson County. So we didn't want to give you that one printed out because that's going to change every hour. This is the foundation that we're going to begin with, and it lays out what type of training you have to have when you bring employees back, how often, the induction, liability. This spells out what's going to happen over the next few weeks. And in your Google Drive, and I can email it to you tonight, it's got a house on the front. It looks like a house or a school. That's the one where we've started plugging in our information for Robeson County. And that truly is what we're gonna do for the next few days and bring it back to the board in the next, hopefully 5 days, so we can approve a plan for the public schools of Robeson County in terms of the scheduling, the calendar, employees, everything. This covers a whole lot. And this is gonna answer most of the questions, and that's why we wanted to bring everyone in. Again, we began these conversations before our board members were sworn in, but we wanted to have the inputs of everyone, so when we did come here to this point, we wouldn't have to go back and change it again and again. So it's something that can happen relatively quickly, because a lot of thought has gone into it. But we can really answer most of these questions once we adopt the plan, when we come back together as a full board. When you come back as a full board.
Just let it, they just updated one of the tools, or one of the toolkits that Dr. Wooten sent last week. One of them was updated today. It has some new information.
Okay. Mr. Brewer?
Is principals and vice principals included in that, in those workshops? Is it mandatory for them to participate, or?
That we're gonna do this week?
Yes.
Representatives, I wanted someone to represent teacher assistants, NCAE, I think I have the principal organization, the president, principal of the year, some of the other principals who have contributed before, teachers. We're trying to get them all here at one point. I know the question was earlier, are we bringing them here? Yes. So even though we have the mass gathering limits, the governor did say we could come together for planning purposes. So that's why we may not be able to stick to the 10, because we're conducting official business. So we want everyone to come for the next few days so we can have these conversations. And so we can get buy-in so the whole community would understand when we have one message.
That's good.
Let me say, if there's no more questions, we're going to be meeting again. We'll decide that at the end of this meeting. If, Dr. Wooten, if you and your staff will get all this together so we can look at it to get the folks back. And folks, I will tell you, this is one of the reasons I wanted to have a meeting like this. You can't have this discussion on a computer. And I think it's needed, and I think there's more needed. But, you know, again, I want to be where I can see face sooner or later, but I'd rather do this than look at a computer. So, Ms. Melissa, you have on there the retirees. If there's no questions, I'll have you to address that.
Okay. I was told just to address the retirees, I think that it may be pertaining to the lap. I'm not sure what, I was just told to put that on there.
I think that
Questions I can answer.
we'll go through and look at vacancies. If we still have shortages, provide vacancy or hire retirees to help when we have, when we need assistance in certain areas, from lab, helping new teachers, mentor. We can bring in our retired employees to provide assistance and fill in the gaps where we have shortages.
Okay, no questions? Ms. Melissa, the beginning teacher support program?
Yes, sir. This past year, we did not renew our contract with UNCP for the BTs. The cost of that was $2,500 per teacher. And so we did not renew that contract this year. Although UNCP did work with two of our high schools, Fairmont High School and Lumberton Senior, because they are part of the College Success District, which are free services. We did receive free services from UNCP, though, for our BTs through workshops and symposiums. So we received some free services, but we did not renew our contract that we had last year, the 18-19 year, because of the cost.
You said $2,500 per teacher. What was the total bill?
Yes.
Overall, we had 300 new teachers, but that we work with the ones, and to give you an exact, Dr. Locklear, it's only 90. 90. We paid $2,500 for 90 teachers. Thank you.
225,000.
2,500 per teacher.
Per teacher.
225,000.
225, 220, okay. Let me throw this out just as a thought, since we have not went back into this, and this would be something to think about later on. We lost one of our mentors, Ms. Campbell, who left, and we're not renewing this contract. So when we get looking at budget and things, I would like to consider getting another mentor there if that money is available, if we still have that money in the budget, looking at that. And if it's still there too, possibly years ago, we had the retirees that were working for us in that capacity too. But just to throw those things out, and we can look at that when we get into budget.
And looking at our numbers, this past year, there were approximately 300 BTs, and that's ones, twos, and threes. This year, we're looking at an estimated number, 200.
because of cutbacks and, where we've closed some schools, we don't have quite as many teachers as we did before. So we're looking at an estimated 200 PT for 2021 school year.
How many last year did you say?
Say that number again.
For last year?
Last year.
Last year, we had approximately 300 VTs, and this year we are expecting approximately 200 due to the cutbacks.
You have a comment?
And I've asked if we could, depending on the conversations we have with Tom Tomberlin, he works with HR at the state level. One thing we need to find out is, are they gonna have the same requirements for beginning teachers if we open up under different models, under option B or option C? So are they still gonna have the same mentoring requirements? And what do we want to see that look like? And honestly, we have hired some people who have not taught before, and it's gonna be very difficult to start teaching in a remote setting when you cannot see your children. So it's gonna be a different type of support that we're gonna provide these teachers, because we do not want them to run away because of COVID-19. So.
Any questions?
I think Dr. Wooten, depending on what plan they end up going with, should the spikes go down of the COVID, do you foresee us having to hire additional teachers? Just possibly.
Couldn't hear.
I said, should the COVID-19 spikes go down for Robertson County, do you foresee, depending on what plan, that we can work with her health department and everything, do you foresee we may have to hire additional teachers?
We could possibly, depending on, I hate to say, we don't know what we're gonna have in terms of those who are scared to return, if they're not gonna return. We have talked about cross-training. If something happens to somebody, we have to have someone the next day to pick up those duties. I mean, at this point, it's so up in the air. I honestly don't know. We're trying to get as many certified employees as we can in terms of classroom teachers. But again, if we have completely online, teachers may be able to teach more students or reach more students. And I'm not sure if they've addressed the class size requirements in a remote or virtual setting. But we don't know at this time, honestly. And I think that's where the retirees will come in too, because they're here, they know it, and they can help pick up right away.
That's why I said if it went down, that's why I said that.
Any other questions?
Sorry.
Yes, sir.
Wasn't there some monies appropriated through the Senate for retirees to go back to low-performing schools or LEAs for assistance? Is that where our retired teachers actually getting paid out of?
No.
I think I know the conversation that they're talking about, like.
Mr. Brewer, there were some return to work rules that were adjusted temporarily to help districts with COVID-19. So typically, a retiree cannot return to a work setting until they've been home as a retiree for 6 months.
Right.
There was a rule of anyone, and forgive me if I get my dates wrong, I believe from October the 1st through April the 1st, if anybody retired during that period, they didn't have to stay out 6 months. They could come back within 1 month, but there was unfunded. There was no money associated with that. They just allowed an adjustment to those return to work requirements of the 6 month to 1.
Okay.
And that would have answered my follow-up if there had been one in regards to the question I was asking.
Anything else? Ms. Melissa, thank you.
Thank
Dr. Robert, summer academic endeavors updates?
Yes, sir. Chairman Lowry, Superintendent Wooten, board members, thank you for giving me the opportunity to give you an update on our summer academic endeavors. For our new board members, I apologize, I hate wearing this mask, but I know I have to. But for our new board members, I just want to give you a brief overview of what I shared with the board members last month, because I think this information is going to help you if you have parents or constituents to call and ask about pacing guides. This year, we have completed we started our 3 through 8 pacing guides for ELA and mathematics last year. And by the end of the summer, we had already completed grades 3 through 8 in ELA mathematics with all the updates based on principal input, based on teacher input, and of course, our supervisors. And also, we just finished up with our 5th and 8th grade science. So when the kids do return and the teachers return, all of those pacing guides have been updated for the upcoming school year, no matter what plan the board decides to go in, whether it's going to be Plan B or Plan C. We're ready no matter what. And also for K2, and I shared this last time, for K2, we have just finished up with our ELA and mathematics, and I know that's something that I heard all last year, because when we gave 3-8, those pacing guides, every time I went to a school, I was cornered in the K2 departments. I want to know when we're going to get our pacing guides like grades 3 through 8. So I want to share with you tonight that those plans and those pacing guides are going to be ready, and our teachers are going to be trained the first week they come back, August the 10th through the 15th. So we're going to be ready day one for grades K through 8, and I'm so excited. And also for our high school mathematics, Miss Mary, let me get her name right here. Miss Mary Smith and Miss Christina Edwards are helping our region to make sure that we have those pacing guides ready for our discrete math, pre-calculus, and then the math 4. So those pacing guides are going to be ready, because that was a question I had a lot last year also, is when are we going to have those pacing guides? So trying to get those put together along with their cohorts across the region. So Ms. Katrina Bailey and Dr. Cummings have been working with them also, along with our contact in Hope County, Dr. Shannon Register. We had a meeting on Tuesday of last week, and we have looked at the pre-work, and it's all coming together. So we're very pleased with what we see so far, and you're going to be pleased also once we get those to you. High school credit recovery, that was one of our endeavors that we hosted for our new board members, June 11th through the 25th. And I just want to share these numbers with you because it's very important that we tried to reach every child we possibly could that needed that extra push to get them finished with that course so that they wouldn't be behind come August. So for Fairmont High School, we reached 116 kids. That's how many needed to come and do some extra work for us. 88 of those kids attended. So anything above 60, 70%, we're very pleased, because it's hard to get high school, and Dr. Mangs, you can allude to that. It's hard to get those high school kids back doing credit recovery. I've been here 4 years with the district, and it's a challenge. It is a challenge. And some of you with high school kids, you know what I'm talking about. Lumberton High, we had 160 we need to work with. 83 of those students came back and completed. Cornell Swift, we had 234, and 140 completed all the requirements. Red Springs High School, 63 required and 63 attended. So we're very pleased with Red Springs High. St. Paul's, 76 and 49 attended. So overall, the numbers are looking good compared to the last 2 years. And although we were in COVID, we were still able to get a lot of the coursework finished for those kids, and they won't be so far behind. Also, we, for our new board members, we hosted, and we're still hosting online courses. We started on June the 15th, and that ends on July 31st. We have 1,045 students enrolled, and those classes, and I'll go through those quickly with you, is ACT, SAT Prep, Environmental Earth Science, English 3, English 4, Sociology, Spanish 1, Spanish 2, Success 101, and World History. And those kids, I checked with Ms. Lane, and they're doing exceptionally well, so we're very pleased with the performance there. And like I said, 1,045, I was very pleased with that number because it did increase from last year. So our kids they do want to get ahead because, like I said, they've had a little downtime, so they're trying to get caught up on some classes that they know, especially those juniors that are going to be seniors. They're trying to get as much as they possibly can this summer so that they'll be ready to start in the fall. Also, this summer we have hosted training because like Ms. Thompson said, we left in March. We didn't know exactly when we were going to come back. So we have been working since, I think around April, right after spring break or right before spring break, putting together our summer remote learning academy, which is our learning management system that we're going to be using and that we used this past year. And that is for Canvas and Google Classroom. So our pre-K2 will be using Google Classroom, and grades 3 through 12 will be using Canvas. So if you look at our teachers across the board, they're all at different levels when it comes to technology. Like, I'm sorry, question.
I have a question. What is the price? What do Canvas and, if the Google, I'm not sure if they charge, but Canvas, would you still have to pay a cost? What do we have in?
Yes, this year we got good news that the state, at our state board meeting last Friday, I think it was, and Ms. Erica, correct me if I'm wrong, or Thursday, they're going to pick up the cost for our learning management system this year, only this year, the upcoming year. And it's normally around what, 80?
It's a little over $21,000.
Yeah, but for a 3-year contract, it's about 80.
It's based on their projected ADM for the school year.
It hadn't gone up much.
It hasn't gone up yet.
Was that a long time ago? Thank you.
Yes, so we were pleased that the state agreed to pay for that, so.
Ms. Brown, Dr. Locklear, Ms. Brown?
Dr. Locklear, the numbers that you gave out for the recovery credit?
Credit recovery, yes, ma'am.
Yes. Okay. How many of those students were we not able to get up with that did not show or participate?
Yes, I don't have the actual numbers. We made contact with all of the rosters that we were given. I can get that, have it ready for you at maybe one of our working sessions, because I didn't include that on the chart, but that's a good point.
You gave a percent, didn't
Yeah,
you?
but
You gave a percent that you served, didn't you?
right, but you're asking how many we,
We're not able to get up with.
I thought about that one today.
it would be a small percentage.
And the reason I asked that, because I think that information need to be included in our work session so we can see
Yeah.
what we need to do.
Because I know, like, I think it was Fairmont High, one of the kids had left to go to Texas to do construction. So they weren't coming back to do a credit recovery, so, but I can get that information for you. Yes, ma'am.
Thank you.
So with our Remote Learning Academy, I want to thank Mr. Cole, who's behind the scenes here with us today, Ms. Stephanie Burton and Lisa Thoman. They have worked tireless, working, as of today, we're working with about 1,000 teachers to make sure, and Mr. Terry, being in the technology field, we have teachers at all levels. We have beginning level, we have the intermediate level, which is the middle, and then we have the advanced. So we have broken those courses down in those 3 categories, because me being, I would probably be like a sort of beginning, intermediate. I'd be somewhere next, I wouldn't be in advanced. And so when I looked at the Canvas for the first time, I was like, wow, this is tough, so not having the technology skills, they have been able to break it down, and it's self-paced, and they are allowed to ask questions. We have, like I said, the ability to, they can text, email us. So we're very pleased with the participation. Like I said, over 900 to 1,000 participants as of today. And then also we're working with our school principals and assistant principals, as well as our curriculum and instruction department, to make sure that they all have the background knowledge in order to make sure that no matter what plan the board goes with, that our Google Classroom platform and the Canvas learning management system, we are ready to go. Because I told you at the last board meeting, and hopefully you remember what I said, we're going to be ready day one for whether it's going to be remote or it's going to be in person. Because we have been hit with 2 hurricanes and our kids suffered, and I still can't get over that. Because I feel like I felt, you talk about, the kids, and I think Mr. Jim, you mentioned that. We let our kids down. And I want to do better. And I know you're going to help us do better, because we're in this together. We have to be in this together, because we don't know what's going to happen. I can't tell you what's going to happen tomorrow, but we can try and make it better. So we really need you to help us with that.
Mr. Chairman, when the committees, I'm glad you brought up about the hurricane. I think when the committee meeting are being held, Dr. Wooten, that need to be included with it for the hurricane. I don't know if that's how y'all got it right now, but I do think it need to be looked into whenever we do these meetings, committee meetings for the COVID and the return of school. I think we need to look at it too also.
Include hurricane into the
We need to because.
preparedness plan.
We gotta, we need to.
Ms. Bonte, do you have a comment? Robert?
Okay, so what I was trying to say is if we have to be out of school, or if the kids won't be able to come back face to face, and we're out for, say, the first 9 weeks, like some of our neighboring counties, or some of our colleagues in other states, where they're gonna be out the entire fall semester, we have to be prepared, and we are prepared. And I want you to know that today, that we are prepared. No matter what direction you tell us to go in, we're ready to go. And that's what we've been doing since, like I said, right before spring break. We have been working expeditiously, trying to make sure that we are ready to go. Because just about every day was like, it's gonna be plan B. Karen and I took a bet today. I said it was gonna be plan C. She said it was gonna be plan B. And then the governor council said it's gonna be plan B. Because we just felt like it was gonna be one or the other. And so we're ready. Because like I said, if we have a hurricane on top of this COVID, I mean, y'all, I don't know if Robeson County can take much more. But strong people like in this room right here will help the district to move forward. Because you're the one that's lighting our way forward. It's the people out there, they don't have the background when it comes to the education piece like you do. You're going to have to sell this to your constituents. And that's why we have to be on the same page. Because I alone can't light your way forward, but us together as a team, we can. And that's what we need, is that teamwork. So when it comes to, and I want to just mention that, let me just read some of the comments that some of our teachers, that your teachers said about this learning management system. And as a reminder, the lady said, make sure you tell the board members, Dr. Locklear, that you can go on our PSRC Digital Teaching and Learning YouTube channel. And on Tuesdays and Thursdays from 10 a.m. or 2 sessions, 10 a.m. and 11:30 a.m., where you can see the actual course sessions in action. So if you want to know what the learning management system is all about, please tune into our YouTube channel, and I'll remind you of our work sessions for the rest of the week. And we may just stop maybe on Thursday at one of the sessions. But one of the teachers said, thank you for this very informative course, great and clear laid out. No areas for improvement. This was the best online course I've ever taken in a while with PSRC. In my opinion, the workshop is a huge success. It is self-paced, and the information presented was not too long, and it was not difficult to understand. So those are some of the comments that our teachers have put in our survey, because they have to do an evaluation after each course. I'm going to skip our jump start. I'm going to save that for last. Some of you have asked about our extended school year with our exceptional children. We are serving 16 students as of today. 13 of those, we have 1 high school teacher, 2 middle school teachers, and 3 elementary teachers that are helping us out. And we have 1 vision impaired, 1 occupational, 1 physical, and 1 speech contact is helping us. So altogether, we're working with 16 kids, and they're doing a great job. I checked in with them on Friday, and they're doing a great job. Some of you have heard about Fast Track. That's coming up the first 3 weeks of school. And Fast Track for our new board members, August the 17th, which is the first day the kids return, through September the 4th, the first 15 days of school, we have developed a curriculum program called Fast Track. It's our intervention plan for grades K through 8. Grades K through 8. And this plan will focus on preparing students for remote learning and address priority standards to bridge learning gaps. If we are face-to-face or if we are remote learning. I'm sorry, Dr. May.
Dr. May?
Mr. Chair, this might be something that Mr. Dwayne Smith said a while ago. What are we going to do with those K-8 children that are suffering?
And I was hoping Mr.
This
Dwayne
is one right here. Mr. Dwayne will be an attempt, I think, to help those children.
I was hoping he was listening to what I was saying.
As far as to, you know, the staff, that's another thing, but this is an attempt right here.
So, so like Mr. Dwayne said, what are we doing for the K-8? So this is going to be a great intervention plan, because the question that came up was, and those kids, if they do return face-to-face on August the 17th, we know those kids have been out of school for 5 months. And you want a first grader, last year was a kindergarten, return to first grade, be on first grade level. That child has been out of school for 5 months, almost a half a year.
Right.
Well, a little over half of the school year, but it's only 9 months. So there's no way that 75 to 80% of our kids are going to be ready where they left. So that's why it's important that we have something in place. And we shared this at our regional meeting last week. And it was the talk of our meeting. I couldn't get my computer up fast enough to share this with the 11 districts that we represent in the St. Louis region. They all wanted to know. And of course, then they wanted to have you already finished all the legwork. They want the whole gamut. So we don't mind sharing, because people have been good to Robeson County. And so we're going to be good to other counties and share all the great things that we're doing here also. So with this 3-week curriculum, and let me just back up a little bit. It was a development from teachers, because we always want to make sure we have teacher input. We want to make sure we have teacher assistant input. We want to have instructional coaches. We want to have supervisors. We want to have principals, assistant principals, central office staff, because it shouldn't be just one person developing this plan. It has to be collaboration. So we had teachers, along with our curriculum supervisors and all the other folks I just mentioned, work on ELA, math for grades K through 8, and science for grades 5 and 8. So the teams consisted of 2 LEA, 2 math, and 2 science teachers. And we also included our digital specialists to work with us. And I know the names I just mentioned, Mr. Cole, Ms. Steph, and Ms. Lisa, they were instrumental in helping us put this together. And along with our students, the service department, Ms. Freeman and Dr. Dorsey, also provided input. It was a collaborative effort of everybody working together. Our arts department, Mr. Ken Brandt, and the Science and Learning Center, Dr. Etta Baldwin, everybody, Mr. Herman, everybody played a part in this, helping us get this together. So with the 3 weeks, we use iRead in this district. And so the first thing we're going to do is we're going to have to assess our kids once they come back. So we'll know exactly where to start with those kids. So after they come back for 5 days, we need to do a quick assessment. Dr. Man, you used to always tell us, make sure within the first 10 days, you assess those kids. So we want to make sure within the first 5 to 7 days that we have assessed those kids and we know exactly where they are, whether it's going to be face-to-face, Mr. Wayne, or whether it's going to be remote learning, so we can help that kid, help the students to get where they need to be. And then once we do that, we're going to make sure that that we continue to focus on the standards, that we need that extra tune-up, and that's how I got its name, Fast Track. Because as kids already know the standard, we can move on down the track to the next standard. So that's going to help us tremendously. And then the last piece I want to share with you is our Jump Start. And for most of you that have kids in the students in the public schools of Robeson County, we used to call it Read to Achieve. How many of you remember Read to Achieve? Mr. Carr, remember Read to Achieve? That used to be our summer enrichment program. And it was used to run about 5 weeks. This year, due to COVID, the legislators gave us 15 days. They provided the funding, and Ms. Erica and I are going to talk about that in a second. But they gave us $1.3 million to work with our low-level students, those students that based on their middle of the year diagnostics test, we had to look and see how many of our students in grades K through 3 needed that extra help. So once we ran the report, Mr. Bobby and Cindy Lewis down in our accountability department, along with Dr. Sandra Evans, ran the numbers. There were 5,617 students that qualified for the program. And I want to repeat that number now. 5,617. Ladies and gentlemen, that's a small community. Really, for Robeson County, that'd be like a mid-sized town. That's a lot of students. So we knew we had a lot of work to get done in 3 weeks. So we started, students started last Tuesday, July 7th, and they'll finish up on July 30th. We are serving 2,481 students. That's what we're serving as of today. So we weren't able to serve all because the students did not have the internet connection. And you know that's a big issue here in Robeson County. We can provide the device. We can give the whole family 2 or 3 brand new computers. But if they don't have the connectivity, that computer is not going to help them at all. So that was the biggest hurdle that we had to face. And it's hard when you can't help those students. And those are the ones that really need the extra help, the ones that don't have the internet. So like I said, we have 2,481 that we're serving. And so, of course, you know, when it comes to funding, there's always limitations and you have to spend it by a certain, you know, they'll give you $1 million and say spend it by next Friday. It was 1.3 million, right, Ms. Eric? Was it 1.3 million?
So, the total was $1,329,035. And, this is one of the budgets. So towards year end, DPI flooded us with allotments. Some of them came in, some of them did not. We actually didn't include this particular budget, but we have something we want to present for information tonight because we just found out in the meeting yesterday with DPI, it's going to be 7 to 10 days before these funds will be released by DPI. This is separate from CARES Act. CARES Act, what I refer to is PRC 163. This is PRC 121, which can only be used for Jumpstart. And part of what has been determined the needs are for the Jumpstart program is with a company called Epics. Am I saying that?
Yes, Epic. Mm-hmm.
And their kits. This company is a sole source kit. You're not going to find this in your packet because, like I said, we just found out yesterday when the release of funds. We're presenting this as information, but for the next meeting, we will need to get approval for this vendor, and we're going to email everybody the information.
And what?
Where did the vendor come from? Who is the state recommended vendor, or was that bidded out?
Actually, Mr. Mike, it was our Sand Hills region. We decided as a team, all the 11 districts, we decided on the product because one of our colleagues in Cumberland County shared it with us, and because they wanted us to think outside the box how we could help the students that we could not reach, and so. Well, I'll let Dr. Manu ask her.
No, somebody else was before me. I'm just raising my hand, waiting on my turn.
All right, because they want us to think outside the box with the K-3 literacy department of DPI. What can we do to make sure that those kids that you could not reach? So this company puts together curriculum kits, and it's a 15, because we're serving our kids for 15 days. So the company, and they're out of Virginia, Stanton, Virginia, and it's called University Circles, but the company is Epic. And they have put together for Cumberland County reading and mathematics, and it comes with all of the different tools the students will need to complete the lessons. And then the only question, and this is something we have to figure out, is once the kids finish the packets, once they finish the curriculum kits, how we're going to make sure that we give feedback. Because as a teacher, I never wanted to give a student an assignment and not give some type of feedback. I just think that is that's a piece that we're working on, and hopefully we'll have that ready at the next board meeting to share that with you. Because that's a big question I had. This kit. How are we going to make sure once the student finishes, how we're going to make sure we assess and evaluate so we'll know what steps to take with, say, little Johnny when he finishes his program.
Mr. Smith, to answer your question, there was not a bid process because the vendor is deemed to be a sole source, meaning they are the only vendor that can provide this information. It's proprietary to their company. So that is why we're presenting it to the board, because the board's required to approve it as a sole source vendor.
Okay. And just, Dr. Robert, just to follow up, Mr. Craig, you talking about the kids that you could not provide service to, is that what you said?
Right, but here, and then we wanted to make sure that we provided something for the students that actually completed the program, because, Ms. Eric, correct if I'm wrong, but we had to spend 50% of the funds by August 31st.
And that was gonna be my next point to show
Yes.
why this is
Oh.
kind of out of order.
Right.
Is because half of these funds, half of the $1.3 million has a requirement to be spent by August the 31st. So we wanted to get it out there as soon as possible because it is in a time limit. And I think it's gonna take this company a month to get the kits together.
put
So
it
we're
all
gonna
together.
get really close to that August 31st date if we don't go ahead and get this approval and place this order.
How does
Mike, they will send the kits directly to the student's home. We don't have to worry about them shipping them to the school.
So y'all have identified the kids, correct? Y'all have identified the kids.
Yes, sir.
They're gonna mail it, I mean, somebody got to sign off, I mean, what's the protocol? How is it gonna be designated and all that?
We have already put together, working with Power School, we have already put together all the addresses, the student's name and their address. We have that in a file. So once, like I said, once we get final approval from the board, because we don't want to do anything unless it's approved, and then we'll be ready to send it to Epic and say, here's our file. You can go ahead and start putting those content kits together for us. So once we get the approval, we can start the ball rolling, because like I said, it's going to take us at least a good 3 weeks to get those in the homes of those students.
I'm an advocate for it because it's putting something in the home. If you remember
Yes.
years ago, we put books in the homes.
Mm-hmm.
It was a great program, and this is like putting a kid in the home. It's helping the kid reading. First I heard about it was through Cumberland County, and it's,
Right.
you know, I would hope that the board would think about it, and maybe the next meeting, if Dr. Wooten and Mr. Craig's having a call meeting, we could make a decision then. I don't know.
We will certainly, I'll email this budget template that's been put together. Again, this plan wasn't due until June the 22nd. So the timing of this is just all.
It was a quick turnaround because, like I said, the money came from the legislators. They said, here's the 1.3 million, make it happen. So Dr. Evans and her team worked, like I said, they worked long hours putting it all together, because we had to do a quick turnaround. So we were able to start on time, which I'm very pleased.
So we'll email the budget template and the service quote from the company along with their sole source letter. So everyone has that in order to make the decision.
Mr. Chairman,
So if I could finish Mr. Mike's question, so he asked about the kids. Also, we want to do something for the students that participate every day. Because you know how students are, they want something. If I go 15 days, what are you going to give me? So the committee decided, and this is where I need your blessing, is that those students will also get a curriculum kit delivered to their home. That will be their incentive, because we got to make sure that we enhance their learning after the 15 days. So that's going to make those students, their background knowledge to increase based on what they're covering in these 3-week lessons.
Mr. Tanner?
Sounds like a good program. My concern is, how do you know that the child that's intended to get the packet gets the packet? Does a parent sign off?
Right, I'm pretty sure if they're sending them like UPS or Federal Express or what is it, Amazon, all the different companies that deliver, normally you have to sign. I'm pretty sure, and I'll check on that, Ms. Brewer, but I'm pretty sure there's like where the parent has to sign. Like our food boxes that are being delivered to the homes, you have to sign for that food box. So that's how we keep track of those food boxes.
There's a follow-up too by the teachers at schools as the kids, you know.
Anything else?
I'm sorry.
Mr. Chairman, I'm willing to set aside policy since it came the 22nd of June anyway. You start counting the dates, this is the 13th, 14th, one of them. I'm willing to make a motion to set aside policy so we can go ahead and move forward on this.
Yeah, Mr. Robert, let me just ask with that, you need this approved as soon as possible.
Yes, because it's over 500.
The cost is over $500,000 and it's a sole source vendor, so it requires approval by the board according to our policy 6430.
Nobody would be employed from the public schools of Robertson County. It'd just be that company.
This is only for this singular purchase. This is, now, there are teachers that are going to be approved tonight, that are working this program over the summer, but that's going to be acted on separately. They won't get paid until we present the full budget. This is just because this company needs a month to get this kit out, and we're getting
Yeah, I understand.
so close to that August the 1st date.
And the urgency, but
And we're still seeing this is the budget template.
they in our package.
They'll be on the personnel list, I believe so, Ms. Thompson, yes.
Yeah, all of the teachers that are working this Jumpstart program, they're in your board packet for tonight. I think you got that Friday, but I think there's like 200 names that we're asking for approval. But Mr. Meyer, I do have the actual, this is just a service quote they sent me, and I can share that. I can have Ms. Patty make copies for you, and it lists all the different components. But this is only for the curriculum kits. It doesn't have, this is the only component is the kit.
And that will be the reason I would love to set aside policy tonight and move forward for the kids.
Because we have to spend 50% by August 31st, or we're gonna lose that money. It's use or lose.
Ms. Gentry?
Robert, I heard you mention feedback. What form will this feedback take? I know teachers are going to be monitoring this and administering
Right, yes,
this, but will it be objective or subjective or a
Yeah,
combination?
that is still worked out, being worked on by the committee, Ms. Gentry, but I'll get that information for you.
Okay.
Other questions? For information, Mr. Robert, the kits, the money for the kits is this 1 million.
Yeah, it comes out of the 1.3 million.
Now, I didn't hear
The 50% is, we're asking the board to approve 612,000 for the curriculum kits.
kids, and that's
It has to be spent by August the 31st.
the money for the teachers. Is that, or is that?
Money for the teachers, that's the other.
In tonight, but based on the previous board meeting, we understand that now you've been named chair, you're gonna set up your committees. We need to know the process that the board wants us to move forward with as how you want us to present full budgets. And so that's the expectation with the work sessions and moving forward. We'll present this budget, however process the board deems they want us to move forward with.
And because there's a change from the last board meeting when there were concerns about the CARES Act. So if it's approved or not approved, we haven't gone through those procedures before in terms of the federal budget amendments, and that stopped us from doing some of the work that needed to take place. So whatever the board decides to go, or which direction you want to go in, let us know and we'll follow that. But in terms of the CARES Act and the information that you're asking about now, you know, it seems as if the board would like to have a new process set up in terms of approving different types of things. We haven't approved, yeah.
We just want to see, I personally just want to see names. When you start appointing people or hiring people, I want their name to be in that packet. I just don't want to be subjective. I want to see who it is and the name
And that's what we're trying to say. So in the past, for certain situations, we have not followed that process, but if that's what we want to do now, just let us know and we'll do it. It just, when you stopped at the last board meeting, that broke from the way we had been handling business. And so we've been held up for a few weeks because we changed up the process,
That's why we're looking at this in one section at a time. We're only discussing the vendor purchase because of this grant, and the way they've seen it is different from how we normally get allotments. We don't normally get allotments that only last for 6 weeks. We have a whole year to spend funds. So that's why we're just bringing forth just this one request, and we'll move forward with whatever process, including I have the template that I still mail out, and the names that are included in this particular grant are in your packet for tonight.
Fair enough for tonight.
And I think the other thing that changed was the concerns about the CARE Act package. Or was there something else that I missed last month?
The process for approval changed at the last board meeting when you didn't approve that specific item, so. And so again, it was stopped last month. I guess there were concerns about the names. However, from what the board decides to choose and when Mr. Lowry sets up his committees, that's why I've just asked, can we have a finance committee meeting You guys tell us which process you want us to follow, and if it's gonna deviate from what's been taking place the past 20 years, let us know and we'll follow that. So we don't have to get hung up and stop what we need to do like day to day if we don't approve something, because we are meeting once a month. So we've been at a standstill somewhat and didn't know which direction to go because we've been waiting for another board meeting. So we just need a process and we'll follow it. Just let us know what you'd like.
I think part of the issue last month, again, was the name situation, but moving that aside, what I want to make sure of tonight, the names for this program is in our packet, is that correct?
Correct.
And the money is, that you're mentioning now what would take care of this?
Yes.
Okay, now everybody's clear on that?
Right.
Okay,
Ms. Craig, the money has to be spent by December 31st. All the funds.
All the funds.
all of them, okay.
Percent of this budget has to be spent by December
But we're looking at,
Quick turnaround.
we're looking at the August right now.
August.
Let's go.
Ms. Brenda, go ahead and go back with what you said.
And move this to an action item.
Second.
Second. Any questions? Comments? Anything else?
Can we say it in very specific terms? Setting aside policy to approve the sole source moving forward, purchasing the 612,000 for the Kids for Jump Start.
Yes.
Yeah, that's what you want us to do.
Not the name,
You just said it.
not the pay.
Not the
Sarah, right,
people,
not
no.
the people.
This is just a kid. Mr. Grady or Ms. Brenda need to read.
The first vote's just to set aside policy to vote.
Okay. Okay, all those in favor of setting aside policy to approve this tonight, please say yes.
Yes.
All those opposed? Okay, Ms. Brenda?
Mr. Grady, I'm good to go forward. Ms. Erica, I approve that we go ahead. I made the motion. The epic information for our students.
Thank you.
Have a motion and a second. All those in favor, please say yes.
Yes.
Opposed?
And again, what we're doing is
Pass it.
establishing this as a sole source vendor that has been approved by the Board of Education. So now we can move forward with this purchase.
Yes.
Okay, thank you.
Okay,
Thank you.
That's all I have.
that it? Robert? Thank you.
Right, thank you.
Thank you.
Folks, before we go to the next item, just let me mention, I sent this around about the committees, so please just give your choices, which of, by putting your name down in 3 places where you would like to serve, and then I'll get the committees together and name the chairman and get that out to you. Also, it's in your packet about confidential closed session minutes. Please, each meeting, you sign those, date them, and get those to Mr. Smith over here before we leave each night. Next item is hazard pay bonuses, Dr. Wooten and Ms. Karen Brooks Floyd.
I think the question came up several times is whether or not we were going to offer hazard pay, hero pay to some of our employees that came into work closed, since the school's closed on March the 13th. So we wanted to just have that discussion with you to decide, you know, let us know which employees, if you would like to proceed with the hazard pay, which employees are certified, the types of jobs that they did, do you want to provide the incentive or the bonus pay for those who provided child nutrition services, maintenance? We need some information so we can go back and determine how many employees, which classes of employees, and where we could possibly pull the money from if you so choose to provide that hazard pay or the bonus.
And let me say, this would be from when school closed until March the 13th, until the end of school. The end of the actual school year.
That's what we have to decide now.
Okay.
Would it be from March 13th to today, or just until, what about 12-month employees? Because child nutrition is going on all summer. So these are the types of things. So the employees certified versus classified, the type of work that was conducted, normal operations versus COVID-19 specific work. If they were told to do that, so if someone was driving buses and we asked them to help with child nutrition, was it officially reclassified for them to help in those areas? And is it something that they would have done if we had not had COVID-19? What are essential functions? And if we can verify and have the documentation from the logs that were submitted to human resources. So if we get the criteria down, then we can go back and look and see how many, who, how much, where we can get the funding, and how we can proceed.
Questions?
Do we have an estimated number of how many people actually work during this COVID-19?
We have it's more specific information for child nutrition, transportation, but in terms of site-specific, some teachers and teacher assistants went out to help with the food, distributing meals when a supervisor did not ask them to do it. They wanted to go out there. So we have to determine, was it an assignment from the district level or a principal? Do we have that documentation? What was their understanding when they signed the telework logs? We have to go back and see what information we have to paint a clearer picture of how we can proceed with the bonus. We just need to know the different criteria. So kind of like just a checkoff list as to what we need to look for and bring back to the board for consideration.
Mr. Grady, you talked about classified and certified. Is there some stipulation? I know we can do some comp time and stuff, but in there, things we need to be careful about.
Salaried employees.
Salary.
The assumption is a salaried employee's being paid for whatever they do versus an hourly employee, which is mostly the classified employees. You're paying them by the hour.
Mr. Salmon?
How are you gonna determine how much each person gonna get? Is you got a formula for that?
That's what we'd have to go back and see how many employees, we can come up with some things. And we have what other counties have done. I know we sent out a survey. We have what Cumberland, Hope, Montgomery County, Moore, Richmond, Sampson. We did find out what other counties were doing, so we can apply that.
I think, Mr. Craig, what we probably need to do is get a number, get a total number of certified and classified. Administration, local level staff, principals or whoever could say, well, this bus driver came out this day. I mean, somehow you got to be able, I don't know, I want to pay everybody that's entitled to be paid, but I sure don't want to pay somebody that didn't work.
Right.
I'll get a little.
That's right.
So we got to have some checks and balances, how we can do this. If administration or school level people can do that, and then, I don't know that we got to act on tonight. We can have some more discussion, of course, but we need to see, I think we need to have a total number first and see.
Mr. Randy?
I'm in favor of paying them for sure.
Yes, sir.
Comp time is up.
Dr. Wooten, Miss Erica, my only question is, was there money sent from Raleigh for COVID-19 for such as this? I mean, did we get any money? And I'm sure you're gonna go over that, or maybe we'll go over that in the next few minutes. But I'm just saying, was any money, nobody's saying nothing. Was there any money sent from Raleigh for COVID-19 to Robeson County?
Yes, there's been all kinds of pots of.
And did it say, is there any stipulations that you can use it for this or that, or can you use it?
Wide open at the discretion of each LEA.
Okay. That's my answer. Huh?
I keep hearing that 900,000, Miss Erica.
28,000.
We still have that money?
No, we spent all that money at $7. And 821,000 of that went to child nutrition to help cover the loss that they experienced between the reduction in meals that they were normally receiving and what they had begun to receive since we converted to the type of meal delivery system we had. So 821,000 of that 928 went to child nutrition. And the other amounts were used for PPE to support child nutrition, PPE to support some of the staff that were coming into work. We got a program for the pre-K, and we also include kindergarten registration to be able to do remote registration for that. And I can provide, that's all I can remember on the top of my head, and I can provide a list of everything, but that so far was what was used to support.
I heard that. I reckon the question now would be then, if you want, Dr. Wood, you said something about a finance meeting or whatever, whoever finance chair, but.
Can't hear you, Mike.
Thing is, if you already spent that 900,000, Where will we get where, if we choose to, where will we get the money from?
That is another question that would have to be answered. There is some money that at the very last minute, specifically for child nutrition only though, that can be used to help support some type of hazard pay, but only for employees working in the child nutrition program. We have access to those funds through December of this year. Otherwise, we'd have to use other funding that PRC already has to pay any staff outside of the feeding program.
Sorry, because the 11 million we talked about last month, can any of that be used for this year? The CARES Act, if we look at that budget, can any of that be used for this?
Well, CARES Act, you have to be very specific. It really mirrors Title I, so you have to be careful in the data and you have to get approval from DPI. It wouldn't rest solely on the Board of Education to say that that could happen. You'd have to submit that in the application with data to support it, and it would have to be approved by Department of Public Instruction.
Let me reiterate with what Erica just said. The CARES Act, and that's why I was going back and forth, making sure it was COVID versus CARES. But the CARES Act, that is federal dollars. And anytime with federal dollars, you have to have a data stream and an assessment to verify why you're making that change. But the application we did send last month, and on page 10 of the application, there were specific areas that we went toward in the CARES Act. But for me to actually adjust that for federal programs, I would have to go to DPI. We would have to provide data. I would have to get guidance from no longer, which is Dr. Thomas Benson, but our new representative, which is Tony Warricks. And then I would have to have sufficient evidence of how they supported sanitizing, cleaning, various pieces of that are specific to the CARES Act on page 10, because as long as we have the data, but I can tell you it would be a push for us to do that with that particular funding source.
And so that's what's coming up. Next will be the CARES Act. So, it wasn't approved locally. Last month, you guys wanted to see the breakdown of what was in there, but that had already been approved by the state at the state level in terms of how we had funds allocated. So, that's already got.
Ms. Brenda?
Ms. Erica, the funds that we saved from the closing of the schools, none of that money can be used either?
That
was
for money. All the state funds, with the only exception of technology and at risk, everything else is done as of June 30th. We get new allotments. We don't get to carry over that money.
We should have took care of that last month.
Uh-huh.
Oh,
You couldn't use.
they can't carry it over.
Took care of that last month.
I should have, because she said couldn't carry it over.
Comp time. I mean, instead of dollars, we may have to do comp.
Let me make this comment, and I'm gonna just say where I stand, and then if no other questions, I'll make another comment. The hazard pay, from some of what I've seen, it went to classified employees as far as the comments and what I could find out that worked. These are ones that worked from when school closed to the end of school. They kind of cut it off at that time from the systems that I did talk to. And it went to basically anybody classified that came in and actually worked at schools. Child nutrition, if it was finance, it was custodian, it was basically anybody that was coming and working, because like in our case, everybody could stay home or they could do telework, but these were classified people that actually come to school. From some of what I found out, I'm not gonna say everybody did it that way. I think you could do it the way it fit your system. My suggestion, or wherever we need to look at this, is if we can find some money to do it, I think we need to do something for those employees that came out and worked like that. If we can't do that with finances, then we definitely, I'm gonna agree with Mr. Mike, we need to look at some comp time. So, if you have a comment, my question or comment would be to have you folks, see what you could come up with, and I'm gonna go back to, make sure there's documentation. If somebody says they were at work and it needs to be documented, signed off, of course, we go here and say we do all this stuff, and then we come up and say, there's no money. That's another situation. So any more comments about how do we need to ask them to go ahead and get this documentation for us, get us some numbers, and see where we can go from there?
I think all the principals know who was out there working with them, and I call them frontline people. Miss Erica, board members, I just think we need to find a way to give the people bonus because they were our frontliners.
We want to. I mean, we certainly do want to do that. We don't want to stand in the way of that. But it's gonna, above and beyond that, we know we may have an active hurricane season. So one thing we have to talk about is policy and how we're gonna compensate if we have another emergency like this. We had Matthew and Florence, where you had, the ones who were out during those two hurricanes were not necessarily the ones that were out during COVID-19. And so we might have another natural disaster and have a different set of essential employees. So we need to start putting processes and policies in place for any time we have someone, risking their safety and help to come and help our students, schools, community. So it's the beginning of a conversation that we can start here, but we'll have to take it further because we may have 2 hurricanes coming up. So we have to prepare for the future too with the policy and processes.
How did the other school district do it? Because everybody in North Carolina school districts appear to have given their staff bonuses, hasn't paid, except us.
Well, it was kind of hit or miss. There
Right.
were some that did and some that didn't, and the way they processed it was different as well. But the counties that I spoke with, and I did not bring the list, I could email that to you.
I have it.
I think I contacted 11 and 6 reached back out to me. 3 of those 6 gave it only to those working with the child nutrition program, and they gave them extra money per hour, either $3 or $4 on top of the money they received for working, for the hours documented during the time they worked. Another district did all classified staff, but all of their classified staff continued to work. None of them went home and teleworked or worked remotely. So they had a consistent number of hours for all those staff and didn't have to break it down to see, well, who was teleworking and who was not, because they all continued to work at their locations. And the other county did time and a half only for their cafeteria employees. So I only spoke to one county that did it for anybody outside of the child nutrition realm. I'm not saying that there weren't other counties that did something different, but that was in our region and the ones that actually responded to my survey.
I just know I made a lot of phone calls to the different counties just to see, and everyone I reached out to did state that they did give a bonus. And I did that because you get a phone, well, I was concerned, number one. Number two, staff was concerned. And the COVID-19 is a different beast. It's a different beast. Hurricanes, we got not comfortable because you don't never get comfortable because Florence was much worse than Matthews. But Matthews taught us a lesson on how to prepare for Florence, and we did a good job to me. COVID-19, we don't know what to do. But I do think we need to try to find a way to find some money, and I think all of you all agree, to help give those frontliners people a bonus or something,
Dr. Whitten, you made a very good point, though. I think what really needs to be done, instead of just talking about it, needs to be a policy. We need to create some kind of policy for emergency situations that frontline people, whomever, well, you work above and beyond, you're gonna get time and a half, you're gonna get whatever, you're gonna get, that needs to be established and put in writing instead of just knee-jerking, in my opinion.
Any other questions?
taking a good step at it.
Dr. Wooten, Ms. Erica, y'all get some information and just get back to us.
Yes, sir.
Surplus, Dr. Wooten, Mr. Hugh.
Good evening, hope y'all doing well.
Kind of you.
As far as surplus, I know there were some questions at last board meeting brought up about having an auction or selling items. We don't have a specific policy for disposal other than the general statute itself. And there's several different options there. One I highly recommend would be a public auction, like we have done in the past 15 years since I've been here. So maintenance is getting together a list of items, including those that were flooded from Hurricane Matthew at the old central office, and any other items that we have down at the warehouse currently 74, whether it be activity buses, certain or tools or whatnot. And once we have that list together, I believe Mr. Hunt, correct me if I'm wrong, what you said last meeting, we need to provide a list of those materials so the board can approve for those items to be surplused. And then go out and either solicit bids for a public auctioneer or contact a local auctioneer company to handle the auction for us, however the board sees fit.
Yes.
That was just information purposes on that, so we can, unless you have questions, we can bring it back next month and act on it, get that information together for us. Any questions?
Can't.
Mr. Hughes?
Yeah.
CARES Act, Ms. Freeman and Dr. Wooten.
Good evening, Chairman Lowry, board members. I was asked to speak about the CARES Act. At this time, we haven't made any additional changes since the last time that we met in terms of the application. That would have to take a movement from you to tell us what you want to do in terms of the data. But just for those that were joining us, that were not with us possibly last month, there were some key areas that we actually used data for. And those areas included technology, that included hardware, software, and connectivity, training for student staff on sanitation. I think that was mentioned earlier by some of you. When will they be trained? So that money does include that. Mental health services and activities related to summer learning and purchasing sanitizing supplies were the big nuggets that the CARES Act covered. I'll entertain any questions to the best of my ability at this time.
Dr. Manuel?
I have several questions. Are you proposing us to approve this tonight to resubmit it?
No, ma'am.
But are you just?
I was just asked to give an update, and I was just
Oh,
reiterating.
okay.
I was just reiterating for those board members that are new to us tonight.
All right.
Give a big nugget review.
Let me ask a question. Is there a possibility, and I think this, Mr. Craig, is there a possibility that we could have a health coordinator in this budget to deal with COVID? I don't mean it could be a nurse, but as a health coordinator to troubleshoot spots and to coordinate all this. I don't mean teach health, I mean a health coordinator.
In terms of nursing services?
I know in terms of the COVID, being the COVID coordinator, if you want to call it, I don't want to call it that.
Where would health department?
We used to have one and they were the link between the health department and the,
We would have to go in, Dr. Manuel, we can certainly look into it because.
I know, I read the guidelines and it would take, you could put it,
We
use
would
it.
have to determine where the budget code is because we haven't done the amendment yet. We do have the opportunity to do an amendment and we certainly could entertain that. Main thing would just be making sure that when I write to the narrative, that I can write to the data to support it.
Did you want to add something?
And it doesn't necessarily have to be the CARES Act because when we have some positions, we have too many, I mean, we can make changes in the reorganization, and that's one of the suggestions tonight. So we can create that and let you look at the job description fairly quickly.
Okay.
So that was one of the suggestions that I was gonna send tonight in terms of reclassification and reorganization. And we do have extra individuals where we could find the funding to do that.
And I also reiterate, we're in the process now of renewing the federal program. Here you do a grant application. Of course, we're in the midst of that, and of course, the third year they've changed again the process somewhat. But it's always built on a needs assessment and data, so we're in the process of making that happen. But you do have Title IV. Title IV is more liberal in terms, we can actually hire personnel in Title IV. We can actually hire additional.
I think you can do it here by me reading the guidelines. But let me ask another question, and this is, I want to make a statement. I really don't have a opposition to the advocates. I have an opposition to their pay. I have an opposition to the pay scale. I have an opposition to specifically that list of personnel. I would like, and this is, I want to speak because I want to get it on the tape because it's been mentioned twice about it being held up. I want to get it on the table. I think it should be advertised and anybody apply for that, but it should be on the same pay scale that they would be ordinarily, not that inflated pay scale. Now, I really, but you know, reading it over and over, I don't have a problem with those positions in the grant. I have a problem with the process of how it was done and their salary. I just want to make that clear because anything to help children, I'm all for it.
You're correct, Dr. Emanuel, the CARES Act does provide for minimum.
Yeah, I don't have a problem with that. I have a problem, and I hope that maybe you could explain what happened to the other board members. Because, you know, I want everyone to work, but if you look at the salary comparable to what they ordinarily would get, some of them got almost a $20,000 raise in 1 year. That's almost as much as a superintendent would get a raise. And I have an issue with that. The issue I also have is put it out there, advertise it. By all means, keep it in the grant, because it's a wonderful opportunity to help our children. But keep the pay in line with our other staff. That's all I say. And that's my comment on this. I don't have a problem. I do. And I think maybe Dr. Wooten, I looked at that sheet, I think maybe she's addressing it. I do think we got to do something about pushing the disinfecting schools. I don't know how we're going to do that. We may have to hire some staff somewhere somehow to help disinfect those desks and all that.
Dr. Wood?
Those people with the break there, I don't know what you call them.
If we can bring back those positions and talk about it, I think that would come up definitely Wednesday, Thursday, Friday in our working sessions. And then you can look, or we could do it in the finance and look at the different salaries and similar positions and start there.
Yeah.
And, because they were focused on the disproportionate suspensions, they may have to do other things, which may cause changes to salaries, but that's all things, those are things that we can put out there to have discussions about to bring back the best recommendation, and uses of the funding, because again, the announcement today, it changed everything. So we will need different types of support in those areas to provide for the students we have. You can make an informed decision whenever we bring it back with the CARES Act, so.
And I would like to add, Dr. Emanuel, and based on the student success advocates and what their role was, when that came to us, we directed it to Dr. Locklear. In part, go back and revisit what would the work look like, because there would be a different purpose somewhat than the outcome. So there has been some work written by Jadelle Hawks and Ricky Bullard, who have that background as well, what that they could provide as terms of social and emotional learning, not necessarily the guidance piece, because they're not.
They need some training, bad to this world, for them to go out and do. But if you look at, and y'all have a great listing of their duties, that's a great listing. But they need some training. Those people hired, and fine people, but they need training to implement all that stuff you got down there. That frightens me, to look at that list and then look at their level of training. So, you know, if they're going to do that, if they apply and they get the job, I think they're going to have to re-enter a training program.
Well, actually, the reality is because of the social emotional learning, we've got to really start looking at retooling the district too, because of the children being out. So part of the work that we do in my department is actually working on the social and emotional aspect, which goes to exactly what you're saying. We have to retool ourselves because our children have been home for an extended period of time. And they've experienced differences than they have before, added on to what they had previously. But I do want to reiterate too, that Title IV does have an opportunity that we can bring that out to when we're doing our work sessions, to have this in addition to. Because my personal opinion is that the more help that we can help our children with that social emotional learning, the better we'll be.
I agree with that. I don't have a problem with that. I just have a problem with the process of how it was done.
And
Dr. Wooten?
And Dr. May, I think that we have to look at alignment, because we have many different types of support personnel in Robeson County. So I think we need to look at, you know, from YDS, counselors, social workers, peer mediators, the student success advocates, and have some type of alignment. A little bit is working in each area that we can take from and build a very comprehensive and effective program. And I think that would be a good start, so.
I agree.
And Mr. Chairman, the cleansing I was speaking of for the schools, That's the cleansing I was talking about, where they go in there. Right, the cleansing.
So, nothing else, I will add the comment as far as what Dr. Manning was saying. I want to be clear. I thought what I saw in there was good, but I did have issues with salaries and no names for programs like that and what the salaries had been. And if we're going to come back and relook at that and advertise and get salaries in line with where I think they should be compared to other things or other people, because we had situations where people's salaries in this, based on what they were doing and what other groups were doing, in my experience, they were just out of line. And that needs to be looked at and advertised for these jobs. And if the title or the name is changed, bring it back to us and we'll look at it again. But I think.
So comprehensive, because that is the world I live in every day, is federal programs world, along with other pieces. That's exactly what we have to do, is we have to see the need, and what I've heard is the need is there. You're clearly articulating that, and we already have the data to support that in the CARES Act.
You got to put them on a pay scale somewhere, like you're saying, Craig. I mean, like Eric, somebody, or the supervisor, or director, or just an employee, somewhere they got to fit in the pay scale. And you got a low range and a high range of what they can make, so to speak, so.
Years of experience in that, on that, yeah.
That's all I don't have a problem with the program, but I have a problem with the process. That's all I have.
And let me add too, that if this money has to be spent, is it by 2022 now?
Yeah.
So if this job is advertised and goes out for people that would be hired, they're going to be explained to, this ends in 2022 or 21? 21? Okay.
21.
Okay. December of 21. September of 21. Okay. That needs to be clearly explained too if it's advertised.
Federal programs, we'll have to be very clear on that, because that's an area that is near and dear to us in terms of federal funding, and we want to always make sure, like you're saying, for Chairman Lowry, what we always want to make sure is that we're actually following what federal programs expects us to do. So thank you for that. We'll revisit that, and I'm hearing Ms. Erica, we probably need to look at Dr. Wooten's salary schedule as well. So that's not in my area, but my area is to go back and work through the process once you get that, and I'll be glad to help you in any way that I can.
Mr. Chairman, Ms. Freeman, before you leave, has any computers, additional computers been ordered yet? Or who would Dr. Wooten?
There's no fund, there's nothing they ordered out of the CARES Act thus far.
None? Okay, thank you.
There were some computers ordered towards the end of the school year by, the technology department, not out of CARES Act.
I mean for the students.
For the students.
Okay.
Yes. There was some Chromebook purchase. I believe it was 130 Chromebooks. I could be wrong, Mr. Field.
Where are we doing closed session?
How do we,
Mr. Henry?
how do we stand with computers versus students that needs them to be virtual, fully virtual?
We need 2,500 computers to be one-on-one K through 12.
2,500.
Right.
But there are some layers to that because some of the computers are aging out.
I didn't go into all that right
Yeah.
now.
Right.
Good, what you said.
We didn't need to go into all that. But that was some of what the CARES Act was gonna be used for.
Correct.
And the CARES Act, if the budget was approved, was gonna be used to order that 2,500, so all that, I won't say.
But there's a renewal cycle.
As they age out, that will be enough to get us to that point. But it's going to be continuous that we're going to have to update because of software and the aging computers.
And that would be a total of 9,000 computers.
9,000?
So, do you have a question?
Cole,
yes.
And the computers that were ordered were the complete,
Cole, I think Cole, can you share with us the numbers?
Total numbers over 12,000 that you need.
What did he say?
Over 12,000.
That would be needed.
Monte?
So from my understanding, if you, who's gonna order computers with the CARES Act, so we're gonna order some more computers. That means if we wanted to start school, we're literally behind now,
right.
right? That said, we wanted to start school, and we haven't, if we haven't voted on the CARES Act stuff, we actually behind the 8 ball and stuff as far as getting stuff done. So okay, my question to the board members stuff, what are we gonna do to try to catch up, or how we gonna get the ball rolling with this CARES Act and get it passed and stuff? Like what are we gonna do to get the ball rolling?
And one reason why we're behind is because, and it was explained on TV, because with the hurricanes, they affected us regionally. But right now, everybody is dealing with the same issue, so we're all competing for resources and equipment. So, that's what I gotta be.
May I make a statement, Mr. Vonday? According to the Education Secretary, of all these CARES money, only 2%'s been spent in the whole United States of America. So it may sound like the delay of 1 month might sound bad to people, but it's really not.
Okay.
One thing
Henry, and then
Dr. Wood said, the inventory though, everybody's gonna be approved, everybody's gonna be going after the inventory for the computers, the technology, the mobile hotspots, everybody's gonna be going for that inventory at the same time.
And PPE.
And everybody gets that inventory usually from the same places. Where do they get it from? Those overseas countries, Mr. Till. I mean. Right.
It is.
Imports coming in slowly and all that kind of stuff. All that plays a factor. So when we want the materials, when we get ready to order it, there's gonna be a delay.
Mr. Henry?
Also like the mobile hotspots that we want.
Process is right.
We're talking about these computers. What about our software that we're gonna use, that the state provides or shares with us that they suggest or we agree on? Where's that, is there agreement, that we have to pay these software companies to use their software, or is that included with the price of the computer?
That's,
And that's the learning management systems that Dr. Locklear was speaking of earlier. Those are the software platforms. We also have some types of software that help with operations in terms of like registration, different things. We did purchase software to help even with efficiency if we have to continue with remote learning. But so we've addressed that portion, and our instructional technology facilitators, Kimberly Floyd, curriculum instruction, Mr. Cole back there, they all come together and decide what's best, and, yeah. But that's been taken.
Sir, could you have a comment?
I was just gonna also mention, when we're talking about, Ms. DeVos, we have also had, I think so far, 3, maybe 4 rulings on how we have to set aside funds for and non-public schools. So every time we get ready to get to a point where we think we're working with our final numbers, we get a new issue of how we have to set aside funds for these private schools in case they want to participate in this grant as well. So that has been an issue we're dealing with ongoing too. There's been at least 3, maybe 4 declarations from the federal government that has changed how those funds are calculated that affect that ability to do.
And we have reached out, we have to look at the nonprofit schools. We don't look at for-profit, we look at nonprofit. And when you look at the directory for schools for the state of North Carolina for private schools, you can't determine. So you have to have a creative way, or either just reach out and call them. So we've been working through that process, but we have some that have already declined. I'm still trying to reach others. So we're working in that process. We have 7 schools that we have to reach out to. Several have already declined. Some are not interested. Some we're having conversations. But letting you know, out of all 7 schools, we have approximately 370 students that would be takers of that for-profit or nonprofit rather. So that gives you an idea. They only have to do a cost calculation, and it gets all to that technical stuff. But that's where we are with that reach out to. So we are in the process of making that happen too.
Jennifer, you have it. You said you reached out to them now. I mean, what's that window of opportunity? I mean, you can't just let them sit there and say some of them will discuss it. Is there a cutoff date?
What we have to do is we have to have a cutoff date by August 1st. We have to make.
They have to respond by August 1st.
Yes.
Yes, sir.
We have to have some, we're required by federal government to do, they want us to have 3 reach outs. And so we want to make sure that that happens, because this is an area that I believe that CARES could be very sensitive, that if we don't actually reach out to our private institutions, as we always have in the past, we just want to make sure that we have really solid documentation in that area, I think.
Okay, if the finance committee, I will tell you, will be appointed by tonight or tomorrow. And I'll be reaching out to you, because we're looking at having another meeting next Tuesday. Finance, there's a good chance you're gonna probably meet Monday night. And as soon as I get the committee, I'll, call out, give you a call. And Dr. Wooten's gonna do some revisions with the group as far as what we talked about with the salaries and everything, and have that ready till you look at it Monday, and then we'll come back and look at it Tuesday night. Okay? Thank you, Ms. Jennifer. RCC agreement, Mr. Grady.
I'll let the agreements with RCC and, to lease part of Green Grove Elementary School. I've reviewed the lease and made lots of changes to the original lease, but Dr. Locklear can tell us about what they proposed to use the property for.
Yes,
RCC.
Green Grove.
RCC. So we met with, Ms. Carrot, I met with Mr. Stephen Conhunt, who is the Vice President for the Workforce Development, because they were looking for a space to, I think it's called the SWAT team, for them to have a place to hold their training and then do their practicums. And so this was a site they looked at, and also Green Grove, and they decided on Green Grove once they found out the central office was moving here. So he took a team from the county plus RCC and with PSRC, and they met over there, and they agreed to the facilities. So that's when I contacted Mr. Grady to figure out how we would transfer that, and he said we had to come up with the lease. He's worked with the RCC, and I don't think they put it in your board packet, but Mr. Grady worked on that with us, and RCC's in agreement. And I think it's what, $1, Mr. Grady?
$1 a year.
But they have to pay $1 a year.
But they also have to maintain all the facility, provide public liability insurance, insure the facility as far as fire coverage. And, so essentially, they're going to be all the utilities. They're going to be fully responsible for the facility.
Ms. Erica?
Was it a 1-year lease, or was it?
It was actually a 10-year lease.
A 10-year, okay, thank you.
But we've got an option of a 60-day period to terminate that lease if, for whatever reason, the board decides to sell that facility. We're not hampered by that lease.
Ms. Erica, do you have a question?
Clarify, Mr. Grady, so all utilities, we would be the responsibility of RCC for reimbursement?
Yes.
Okay.
Any questions? Is that something that needs to be moved and looked at, or where are we at with that?
We need to move it to action item, and because I think they're
ready.
Yeah, ready to occupy the facility now.
Mr. Chairman, the only concern I have, well, let me ask Dr. Wooten this here. Dr. Wooten, do you foresee, because you've been meeting with Stephanie Chavis from the emergency management, do you foresee us having to use that building because of it? Because I don't want to make a motion and just to approve it, and that we have other reason we may have to use it.
We may, but we've got shelters. We did walkthroughs with Stephanie Chavis, the DSS director, to determine which sites would be good for COVID-19, and we had to increase that number because they won't be typical shelters this year. If we have a hurricane, you have to have the shelters plus social distancing. So we had to increase those numbers, and also in several of our schools, depending on the need, may serve as medical surge facilities. So if the hospitals reach capacity, we may have to turn some of our schools into healthcare settings to provide services. So, it's not just limited to Green Grove, and we identified several different schools that would serve as medical surge facilities and shelters in the event we have a hurricane. So I don't see that would hinder or stop any progress we'll still be able to provide support for emergency management.
Okay, thank you.
That's where the 60-day clause comes in.
Yes.
That's where
Right.
clause.
Terry, do you have a question?
Yeah, going back to the discussion about Green Grove, if RCC makes any sort of changes to the facility, are they required to put it back in place the way it was?
Well, they can't make any changes pursuant to the lease unless we approve it. The board it's got to be pre-approved.
I don't think it need to be.
Sorry.
I'm sorry.
I don't think it need to be 10 years.
So we should still continue to insure the building? We should, or is
RCC's
liability insurance for?
They're responsible for the liability and fire cover.
Okay, I'm not sure, you and I'll check, but if that is.
I mean, they can reimburse,
Okay.
yeah. I understand what you're saying.
Right, and if that's one in the flood area, I'm not sure if it's not.
It's not.
Okay.
So all expenses that would occur there, RCC would be responsible
They'd
for.
absorb them.
They would have to absorb everything. Okay?
10 years is just a long time to me with the unknowns.
Pleasure of the board tonight on this.
Make a motion, set aside policy, Mr. Chairman.
Motion is made to set aside.
Second.
Have a second.
For 10 years?
Yeah,
10 years, right?
you can get out anytime.
And you can get out of it in 60 days.
Okay, cool. I'm cool then. Okay, thank you.
So that is clear. With a 60-day notice, we can
I thought
get,
that was on their side.
okay.
Okay, I'm cool.
All those in favor, please say yes.
Yeah.
Yes.
Any opposed? Need a motion to approve the lease?
Make a motion.
So move, Mr. Chairman.
Go ahead.
So move, Mr. Chairman.
Second. All those in favor, please say yes.
Yes.
Any opposed? Okay, motion passes.
Thank y'all. Thank you, Mr.
The RCC Board of Trustee appointment, that is on the information items. We need that to be acted on tonight. Do we get a motion to move that to an action item?
Move, Mr. Chairman.
Second.
I have motion and second. All those in agreement, so signify by saying yes.
Yes.
Any opposed? Okay, at this time, we would take nominations or nomination for that position.
Mr. Chairman, I make a motion to nominate Mr. Bosco Locklear.
Second.
Okay, all those in favor, please say yes.
Yes.
Any opposed? Okay, Mr. Bosco Locklear will be the trustee from PSRC. Action items, Ms. Erica?
And Chairman Lowe, Dr. Wooten, and all, everyone else here in attendance. I have for you tonight the monthly financial report for June and the budget amendments. Well, let's do the financial report first, sorry. The financial report for the June, and I know you may not want this to be the point at whatever time it is tonight for me to go over exactly what this is, but just for the new members, what this is a collection of all of our 7 funding sources and shows the breakdown of what we did in June. It shows the monthly expenses for June and the ending balances. And I know we will probably, as we move forward with those finance committees, have more detailed discussion on what all that entails and where all these funding sources come from.
Anybody have a question? Now, I won't mention a couple of things, but does anyone have a question to Ms. Erica? Ms. Erica, and folks, I know it's getting late, a lot of information, but I do think it's important that it's covered tonight. Ms. Erica, if you could, real quick, the paper you raised up, it's got state, federal, enterprise, and local, everything that's there. If you could just briefly, where does that money come from, each of those? And like at the end of the first one there, the end of the state budget, there's 2 figures there that are the same. Just quickly, kind of briefly tell us, like, what does those figures mean there?
When I submit this, in order to have a balanced budget, you have to have your revenues and expenditures, and they have to equal. So just for state funds, those are state allocations that we get directly from the public schools. The General Assembly approves our formulas and allocations, and DPI sends us these areas. So the program is what we refer to as the PRC, and you'll see the description beside each of those. So most of these areas are very specific in nature as to how the funds have to be spent. Classroom teachers, self-explanatory, central office admin, and so forth. So the current budget is what we had for the entire year, June, what we spent in that month, year to date, and then remaining balance. With some of these though, the remaining balance is not really what we look at because they're position allotments. So like for classroom teachers, we get an allotment of positions. And I believe we ended up with right at 1,000 classroom teachers. So the state covers 1,000 positions for us, regardless of what it costs that teacher. So we also have to balance here, and there's not really $652,000 left because we have to balance down. We had 0.27 months left. So that's the kind of things that we can get into more detail. I'm sorry, I'm rambling. I apologize. Things we can get in detail about. So we'll start with the state there. And why you see the numbers the same is because we show the expenses and the revenues. Same thing with local. We categorize everything by a certain type of expense, but local is our most flexible option of spending. It's also the lowest area we have funding. But that is where we will have all of our grant funding, our Indian education, and so forth. Those funds carry over, all but PRCs and states end on June 30th. We get new allocations. The federal would include everything from our Title I, CARES Act, Title IV, CTE, homeless, preschool, our IDA, handicap funds, and just about every one of these requires some type of a grant application that has to be resubmitted annually every year to DPI and approved by the different programs there with the department.
Erica, on that one, the end of the local, there's brackets around those, and the other ones don't have like parentheses around them. Is there any, what's the reasoning for that?
You said in the local?
Yeah, if you go to the end of local, I think that's 975,000. It shows parentheses in the last lines around those, and those other ones, the earlier ones, the state, I think, and the federal, it's just figures there. Is that?
Everything at the bottom with your revenue, by default, revenue, the increase that you credit as a balance. So that's why those have the credit balance with your revenue source, and as expenses have a debit balance. That's the accounting brain. So that's why you'll see the credit and the debit associated with it.
Is it appropriate time to ask about, you mentioned grants and federal. Do we have a grant writer?
No, sir. We have a grant committee. We had a grant writer prior to the recession, and that was one of the positions that was eliminated because of loss of funding.
Federal programs doesn't require a grant writer. It's a general application that's renewed annually. And so we just going through a process where we do the needs assessment, and it's not the same as writing a grant,
Gotcha.
another type of.
Supplemental.
Add each of them we're on, and we just take the data that we get. We do those data pools and start having conversations, complete the grant. We're in that renewal cycle, and it comes up each year annually.
Gotcha.
There are grants the district has received through the grant committees and through a host of other people involved. And some examples are a SCORE grant we just received, and it has heavy on social and emotional needs of students. That's one we just. Safety grant with our resource officers. We received that in the prior year. So there are several committees that write different grants, and some of them may be directly offered from the state or nonprofit. It's a combination of all different funding sources.
Ms. Erica, because it's not up anywhere and we're online, can you read out what the state balance and all of them is like you normally do?
Can I do what? I'm sorry.
You normally give the budget report and you normally call out what the balance is?
For the local and the capital? Well, I don't have that yet because the next 2 months, we have to record payables in the prior year. So once we finish with that, then I'll have those reports for June because it's year end.
Okay, thank you.
So then we move to capital outlay. In capital outlay, we get money through directly from the county. Also through lottery funds, if we have any specific applications, we get reimbursed for lottery through Capital. And Capital takes care of all of our buildings and our athletic facilities, athletic fields, and so forth. And enterprise, by definition, is self-supporting. So enterprise funds, I look at them as a business. They should take in enough income to fully support all of their expenditures. And what's included in the enterprise fund is the child nutrition program, the Shining Stars daycare, and the Prime Time program. And that's our 7 major funding, state, local funding, which most of that comes from the county as far as our county appropriations. Then we have federal capital outlay and enterprise of companies, child nutrition, Shining Stars, and Prime Time.
Okay, thank you. Any questions there? I think you have that one more, some of the information on budget amendments.
So I wanted to be clear on the budget amendments. The budget amendment that was submitted last month for the CARES Act is included in this document again, but I put additional verbiage that says, this is a resubmission of the June 2024 meeting federal amendment that includes the CARES Act budget. This amendment is for the budget resolution only. None of the funds from the CARES Act were spent in 1920, and none of the funds will be spent in 2021 until a budget is submitted by both the PSRC Board of Education and the Department of Public Instruction. Again, this amendment only approves the budget for 1920, and no funds were spent or can be spent from that fiscal year since it closed on June 30th. I just wanted to make that clear that we're only approving the budget. We're not approving moving forward any expenditures in the CARES Act. That will require us to resubmit the CARES Act again in the 2021. And the others are state, local, and enterprise funds.
Move approval, Mr. Chairman.
Any questions?
I can do it kind of fast, we can start the school year.
A motion to approve?
Second.
All those in favor, say yes.
Yes.
Financial report, we're talking about the amendment.
Oh, I'm sorry. Move to approval. Let's do the financial report first. That's the first stuff. Have a motion to approve the financial report. All those opposed? Okay, do we have a motion to approve the budget amendments?
Make a motion to approve the budget amendments.
Second.
A motion and second. All those in agreement, please signify by saying yes.
Yes.
Thank you.
Mr. Randy, I think you're stepping into some shoes tonight.
Here we go.
Go ahead.
Motion that the Board of Education for the Public Schools of Robertson County go into closed session for the purpose of discussing certified and classified personnel, North Carolina General Statute 143-318.11A1. And student transfers, North Carolina General Statute 15C-402.
Second, yes.
Second. All those in favor?
Aye.
Aye. All those opposed?
Yeah.
Can somebody
You got to work on it. Folks, let's take about 5 minutes and we'll come back. Motion to come out of closed session.
Second.
All those in favor say aye.
Aye.
Motion to accept the information given in closed session.
Make motion to accept closed session minutes, notes, information.
Closed session personnel.
Last month.
Last month.
Second.
All those in favor say aye.
Aye.
Any opposed?
Move approval of personnel as presented.
Second.
All those in favor say aye.
Aye.
Any opposed? That it?
Got everything?
That it? Okay, what we're looking at doing is, just remind you, they will be here tomorrow, Thursday and Friday from around 10 to 4, working on, reentry plans and other information. What we would like to do is recess the meeting tonight until next Tuesday at 6 o'clock, back here, in the same situation. I guess it will be conducted the same way. And, Finance Committee, as I said, I will get that information to you tomorrow, and Finance Committee look at meeting on Monday night, and, whoever's the chair, if you have some information, and Dr. Wooten's also want to have some information that needs to be covered, that hopefully we could act on it that Tuesday night.
Monday night.
Okay, could we have a motion to recess until next Tuesday?
Sure.
Ben?
What about the public comments?
I'm sorry. We just accept the public comments on the record,
And I'm getting ready to email them to everybody.
and they will be emailed to you. They will not be there
They don't be read to the public?
tonight. No, sir.
Let me ask you this, Mr. Chairman. I know the cabinet's gonna be meeting in the next few days, and my personal schedule is pretty tight, to be honest with you. I mean, how do we go, I noticed we had the people here from the health department, all this stuff. Are you gonna make the recommendation, Dr. Wooten? Are we gonna make the recommendation? Are we going B? I mean, I know what the governor said today. Are we gonna go, I mean, somehow, where are we gonna be, are we just gonna wait the next Tuesday and do that? Or is it gonna go through this process? I just need to know, so.
We're gonna work on both scenarios because, again, we have to be ready to transition at any point. So, we'll focus largely on, Plan B, because that's the one that's the most labor intensive, and requires the most resources and the funding. Option C, we're pretty close to finalizing that, but most of the work will be B. And again, we're gonna have to transition at some point, and if we start with C, we're gonna have to loosen those restrictions when the metrics improve. So again, the board will decide next week which option, C or B, depending on the data. And
That's what the governor said.
we can
Virtual stuff, I mean, we can kind of do our own little.
Yes, we can do virtual. We can go along with the governor. We can't do anything less restrictive, so we can't go to Plan A, but we can do something more restrictive depending on our local needs. So we can choose to go to option C, because Scotland County, they decided today to do option C just for 9 weeks until the metrics improve. So we can, of course, if we do B, we can certainly do C to start the year off.
Or we could do like Wayne mentioned earlier, we could say we're gonna do K-8, or we could.
Right, so-
It's still up in the air right now.
Yes, we have different scenarios, so it could be pre-K3, pre-K5, pre-K8. We've had different conversations, and honestly, it depends on the capacity of the building and how many we can fit in certain schools. And what type of schedule we're gonna use, whether it's a rotation, half days, staggered schedule. So those are the things we'll be working out this week, and we'll bring back to you what we think is the most effective.
Well, did you hear the governor today, Dr. Wooten, call our name out, Robertson County?
Yes.
He said we had made a decision.
What kind of,
Not the governor, the board chair.
Eric Davis.
Eric Davis, the one said it.
He said he was.
these workshops gonna be held here?
Yes, sir.
Elementary students.
Yeah.
So repeat it, Dr. Hoffman.
Yeah, Chairman Davis said that he called out Wake County, Chapel Hill, and Robeson County. And he said he was glad to see that those 3 districts were working on the elementary students.
Yeah.
They had a concern for the elementary students.
Mr. Robert, my comment, he also said that our 912 was going virtual. Now, that was the other comment that he said.
He did.
Yeah,
The 912 in Robinson was going to be virtual.
because of
Put that on TV also.
Robinson,
COVID, I think being so high.
and there were 3 counties.
I didn't hear the, I was
I didn't hear-
excited when he caught out his first time.
Because of the high.
I was wondering where he got the information, if there's a decision that was already made.
So,
It's just
you're-
concerned because of.
Mr. Wayne, go ahead. No, go ahead.
Go ahead and ask the question.
I was just, with what's going to be done this week, and again, it's 10 to 4 the next 3 days. Y'all will come back with recommendations. We will look at those and we will end up voting on everything next Tuesday as far as what is sent to the state. And now, we don't have to wait on approval to start implementing, or we do? I mean, there's some things we can do anyway as far as cleaning and what have you that we've talked about.
We had an initial plan that was approved at the state level, but they've come back several times over the past few weeks and have had us to redo based on the changing metrics. So it could have been they started and they wanted us to come up with the first 9 weeks. Then they went back and said, well, prepare for the whole school year online. So as conditions have changed, the requirements in terms of planning have changed. And I'm not sure where they got the 912 from, but we're certainly going to talk about how we can provide support for the older students because, online virtual for the state, they can handle below 9th grade. So again, it's going to be determined on, what we put together, what we would like to see happen, the capacity in our school facilities. And honestly, we got to have to match staffing to our student needs and population. And again, if we do the hybrid, the governor still is talking about having a virtual option for those who do not want to come in the facility at this time. So there are many, many different options. So online virtual, they can support 6 through 12. But those are conversations. If we want to choose 8 through 12, we can do that. So we have a lot of flexibility in our planning. But again, those are just the small details that have to be ironed out this week. But nothing is set in stone whatsoever.
Robert, Mr. Wayne had his hand. Mr. Wayne, you have a question?
Yes, sir, I'm just ready to recess.
Okay. Robert? Dr. Robert?
Piggybacking off what Dr. Wood said, we sent out a survey to our parents and families. And as of this afternoon when I checked, over 3,000 parents have responded and plan options, plan C.
Plan B and C had almost 75%. And also we sent out a survey to get information from employees too. And that's when we had the online forum last week, answering questions. And they submitted over 350 questions to us with their concerns and considerations. Again, if they're scared to come back in the facility, then perhaps they could help with the virtual academy, the virtual option. And we have to match the numbers with the students, the ADM, and look at funding, PPE, and a lot of different things.
Mr. Mike?
I'm good. I'll wait. We got a lot of work to do in the next few days.
It's a lot.
Do we have a motion to recess?
Mr. Chairman, don't recess without thanking our staff for this past year. All the work that they have done. It's that much. I said, don't recess without thanking all of our staff for all the work that they have done.
Well, I need to thank all of the staff here, what they've done, and the staff that's out there and what you've done, not only this past year, but especially this past 5 or 6 months. And thank the board members that's been here, and I'm going to thank the new ones in advance for what you're going to do. And tonight was probably a good example. There's a lot of work to be done, But again, thank everyone for what you have done and what will be coming forward. Motion to recess.
Second.
Okay. Second. See you later. Peace.